commence the Regional Council meeting of Thursday, March 12th. I would call everyone to order, and let me begin with our Indigenous land acknowledgement. We would like to begin by, roll call, my apologies. Roll call first. All members are present except Councillor Demerla, away on personal matter. Councillor Kovac has not joined us yet. Councillor McFadden away on a personal matter. Councillor Medeiros is still not here. Councillor Raz away on a personal matter. And Mayor Thompson, who is being replaced by Councillor Early today. Welcome. All other members are present. With that, we go to our Indigenous land acknowledgement. We would like to begin by acknowledging that the lands on which we gather and which the Region of Peel operates is part of the treaty lands and territory of the Mississaugas of the Credit. For thousands of years, Indigenous peoples inhabited and cared for this land. In particular, we acknowledge the territory of the Shinnenabec, Huron-Wendat, Haudenosaunee, and the Ojibwe Chippewa peoples, and land that is home to the Métis, and most recently, the territory of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit. We are grateful to have this opportunity to work on this land, and by doing so, give our respect to its first inhabitants. Okay, declarations of any conflict of interest. Seeing none. Approval of the minutes from February 27th. I have a motion. It's been moved by Councillors Grove and Starr that the minutes of the February 27th Regional Council meeting be approved. All those in favor? Any opposed? That is carried. Now we go to our consent agenda. Approval of the agenda first, actually. And that is moved by, and I believe it's also Groves and, not yet. I need a mover and a seconder, Councillors Paleshi and Parrish. Sorry.
No, we have people on the list.
Here we go. Let me start with Councillor Parrish.
Yes, under Section 19, other business, I'd like to add an update on the search for the CAO consultants.
Okay. Duly noted. Councillor Sato.
Thank you. I guess this would be under Section 19 as well, other business. I'd like to add a request for a motion with regard to electronic voting of council in case of emergency situations.
Very good. Okay.
And I have asked Patrick and all of the staff at the back table there to prepare a motion on that regard. Thank you.
Thank you. So with that, I have approval of the agenda as amended. Not to myself. Have we got one more item? There is an additional agenda matter other than the two that we've just noted, that the agenda for the March 12th, 2020 Regional Council meeting include a delegation by Rob Harrison, Director, Valleywood Residents Association, regarding Regional Official Plan Amendment 34, and further that the agenda for March 12th, 2020 Regional Council meeting be approved as amended. Madam Clerk, a recorded vote for that? No. Show of hands. All those in favor of the agenda as amended, that carries. Thank you. Now we are on to our consent agenda. Following the staff presentations and the delegations, the first items I have related to health, item 9.1. Do I have consent? Consent, item 9.2. Consent, item 11.1. Here for information. Consent. We're good. We're good for now? Okay. Moving on to items 13, planning. Item 13.1, to be held. Item 13.1. 13.2. I'll start. Does anybody wish to have 13.1 held? On consent, 13.2 to be held. Okay. Communications items 14.1 on consent, 14.2 on consent. Items related to enterprise programs and services, 15.1 on consent, 15.2. Consent, 15.3. On consent, the communication matters, 16.1 to be held, 16.2 to be held, 16.3 on consent, 16.4 on consent. Public Works, 17.1 on consent, 17.2 is on consent with a presentation to follow a little earlier in the morning. 17.3 on consent as well. The communication matter 18.1 on consent. Other business 19.1 on consent. Then I'm down to the bylaws. So with that, sorry, Madam Clerk, anything further? I was going to take the vote on our consent agenda. That is a recorded vote as moved by Councillors Mahoney and Innes. All those in favor of our consent agenda? Couple more still to vote, or are we good? We're good. That carries, and thank you. Okay, with that, we start with delegation.
Sorry, you have to do the water.
Oh, sorry, yes, let's do the Water Week item right now. We're going to, and I don't know if they've given me a little bit of a script, so let me start with that. Okay, before we begin today's council meeting, I'd like to take a moment and recognize a great initiative we participate in here at the Region of Peel. Canada Water Week is a week-long celebration of water from coast to coast to coast, held annually in March to coincide with World Water Day on March 22nd. In recognition of Canada Water Week and World Water Day, we will be taking a synchronized drinking of water to show our support for Peel's high-quality, safe, and clean tap water. Also celebrating with us today is the Region of Peel's water mascot, Dewdrop. Hello, Dewdrop. Wait, where is he, Dewdrop? Welcome. Who will be joining us as well as we take our drink of water. Water is vital for life, so you should be proud of the services we provide and the work that we do. Every day, 200 regional staff treat, test, build, and maintain our water supply. If you're one of these people, I thank you on behalf of all regional council. Would everyone now raise their reusable bottle, glass, or mug, and I'm hoping everybody's been primed. Perhaps the staff can help me. We're going to have all of my colleagues perhaps come around and grab a glass so we can get a photo with Dewdrop. So I need everybody up, if you would, and join me.
So what they'd like you to do is move to the front, grab a glass. Don't share the glass.
Yeah. Let's not share the glasses today, all right? Let's.
And they're going to take a picture for social media.
Okay. And this is a photo for social media. Should I go?
Yeah.
He's coming with respect to 13.2.
Okay, and we're back. Councillor Parrish, I have you on my, that's from before, very good, we'll carry on. So as we said, we have an additional delegation. It would be Mr. Rob Harrison, Director of the Valued Residents Association, with regards to item 13.2. Mr. Harrison, please. Welcome.
Good morning, and thank you for this forum. Mr. Chair, I'm returning today with some recent information I've received that ties to the 410 component I spoke of on February 13. And at that time, Mayor Thompson had provided an option for us to meet with staff regarding his fire and emergency, regarding our fire and emergency concerns. Thank you. And since then, we have received a letter, been made aware of a letter on the back of the, and it's to you, sir. And it's from, it's signed Mr. Douglas Brown. And it speaks to a wholesomeness that appears to be a compliance with the strategy of emergency and fire systems within Caledon. Does that ring a bell, sir? March 4th, 2020. Her worship, your worship, Nando. I'm sorry, I can't say your last name very well. This document.
Nando's perfect, but if you, I don't have the letter before me.
Yeah.
But if we could have it up on the screen for everybody
That'd be
else.
great.
Okay, and this is a letter addressed to me, not by me, correct?
Correct,
Very
absolutely,
good.
sir.
Okay. Yep, carry
And the
on.
letter speaks to, as, can I just read it, because I've only got this letter hours ago. As the Chief of Emergency Management for Ontario, it is incumbent upon me, the author, Douglas Brown, to monitor, coordinate, and assist municipalities in their respective municipal emergency management programs in accordance with the Emergency Management and Civil Protection Act. Our topic on the 13th related to emergency response. We brought you a document that is not here, but it's on the record. It was a Ministry of Labor summary for an investigation that indicated the gate required 410 closure, Highway 410 closure, to enable the use of the gate. This time that would be required to shut down the highway would be over and above the response time, which I believe is about 14 minutes. I would suggest we're adding 15 to 20 minutes to the 14 existing response time minutes within provincial guidelines.
Yeah.
And as such, that information of 20 minutes was not included in the Master Fire Plan of 2018, document 163434. Therefore, in my opinion, if we go forward voting on ROPA 34, Mr. Thompson at the 13th offered us a meeting with staff about these kind of topics, and now we're voting on ROPA 34, to which our topic is the transportation component. Therefore, I am arguing, respectfully, the ROPA 34 topic is somewhat premature to be voted on with finality. We still haven't had our meeting, and this new and relevant evidence seems rather interesting and timely, 20 days after I presented my topic of rather vivid concerns. And I guess that's about all I'm trying to say.
Okay. First of all, thank you very much.
Thank you,
I
sir.
don't know if staff have responded, but just in refreshing myself on the letter addressed to me on behalf of all of Regional Council does say quite clearly in the third paragraph, you, and that would be Regional Council, are to be congratulated on your municipality's efforts in achieving compliance in 2019, which is a good thing, I would think. Look forward to working with us in 2020. So I'm glad that that's refreshed. And it was on an agenda item 16.41, and it was duly recommended for receipt at the time. So we've dealt with that. To your question, I don't know if staff or anyone would like to, Commissioner Lockyer, would you? And then I'll go to questions. Councillor Downey may have a question as well. No, you had your chance. I'll let them speak first.
Thank you through the chair. Mr. Harrison, the letter that you're referring to is in connection with the 15 pillars of emergency management as opposed to emergency response.
Okay.
So this letter is in connection with the region being prepared and providing the information to the Fire Marshal of Ontario that we are prepared in the event of an emergency such as flooding, fire, those kinds of things, not emergency response. So they are two different things that we're talking about. So this letter is in actual fact not related to emergency response.
Okay.
It's related to regional emergency operations.
Okay.
Which would be business continuity, if there's a spill, if there's those kinds of things. It's not in connection with emergency response.
Okay.
Thank you. Are there other speakers? Councillor Downey.
Thank you. Through you, Chair. Although, as staff have pointed out, it's slightly unrelated, but maybe to put the delegates' mind at ease, our fire master plan was presented to Council on Tuesday evening of this week, and I'd be happy to share that information. The Valleywood egress was addressed at that time by our fire chief and by the consultant that is working through the fire master plan.
Mike, I have several questions.
Oh, I'll tell you what.
Not several, not long, sorry.
Then just hang on. I don't know if it was response to what was said, because I have Councillor Groves. Perhaps I'll acknowledge Councillor Groves first, then we'll go give the deputant one last chance. Councillor Groves on my list.
Thank you, Mr. Chair. And just following up with Councillor Downey, I did raise that question when on Tuesday at our when the fire master plan was presented. I actually did not get a very clear answer on it because there's new legislation that came out, a new piece of regulation, I think it's 378-18, which speaks to community risk. The consultant, when I asked the question, couldn't address that. He couldn't address it specifically to Valleywood, and that's what I was looking for. It's the issue with the gate, Mr. Chair, and it's been an issue for a long time, and it's been a concern that the Valleywood people had. I never got a clear answer with respect to that from that consultant. So, given the fact that this new piece of regulations come out on how to manage or deal with community risk, I think it's important that we figure out whether or not there are risks to the folks living in Valleywood, because that's been an ongoing concern, I would say, for the last dozen years.
And Councillor Groves, just to be clear, the meeting of which you speak on Tuesday evening, what meeting would that have been?
That was a meeting at the town on the fire master plan.
Okay, very good. Not a regional meeting.
No.
Very good.
Yes,
Sir,
thank you.
last chance to you, the last few points that you wish to make.
Okay, so initially, sir, if I might rebut, I want to underscore that we're all on the same page. Paragraph 3 says, the safety of our citizens is important. To Ms. Lockyer, I would suggest that when she mentioned emergency services, if we have a spill and we need to use that gate because the spill happens to be at the Valleywood intersection, I'm talking about the same thing. The traffic in Valleywood intersection is probably going to double. I can't speak to the specifics, but when the ROPA 34 properties become available, our bridge is the one that's overloaded. Can I add, please, S5-10 has been approved. We've never had these planets line up like we have right now. And here we are, as my understanding is, we're voting on this topic today to proceed with ROPA 34, which in essence turns 4 lanes of traffic on a shoulderless bridge as the only viable means to access and egress Valleywood. The gate now, with the document provided last 13th of February in this room, that document, if studied and understood, it calculates 15 to 20 minutes additional to the 14-minute response time I'm understanding to be still 14 minutes since the new, So, okay, so we're up to 34 minutes to respond if somebody spills something that Ms. Lockyer speaks about on our bridge that has had the traffic double. There are no more lanes for passage, no more lanes to pull over because the traffic is doubling using all the lanes on the bridge. Please do not vote on ROPA 34 until we get a chance to speak, excuse me, to the people on the 17th. We are destined to meet on the 13th. I guess that would be it. Okay. I hope somebody puts forth a more motion for this.
Councillor Downey.
Thank you. Through you, Chair. Although I appreciate the delegates' point of view on this particular issue, Valleywood, the southwest corner of Caledon, is in my area, and Councillor Early as well. The fire chief did address this holistically on Tuesday evening during our fire master plan meeting. I was quite satisfied with his responses to the gate. So, I mean, all I can say is that our fire chief has had input onto ROPA 30 as well. It's circulated to all of our staff. They're consulted with, and they have no concerns over this. And just for the knowledge of my colleagues around the table, the actual fire department is in Valleywood.
Yeah.
So it's not a matter of a question of emergency response getting in or out. In terms of the traffic, they have access to that gate. If there's an emergency situation, our EMS teams have access to that gate and can utilize that gate if needed to get onto Highway 10.
Yeah. I might add, Councillor Downey, on other related regional emergency services files, the chair's had a briefing on this as well, and I've been told much of what you've been told as well. But, sorry, thank you for being here. All I can suggest is we move receipt of the information, and I think it's still a work in progress, and you're telling me the Caledon's still working on it and working itself through the system. I don't know that we can do more than that for the time being. So, Councillor Downey, if you'd move receipt of the delegation, seconded by Councillor Sinclair. All those in favor? That is carried. Thank you for your presentation. With that, I come to staff presentations. 8.1, update on the novel coronavirus, presentation by Dr. Jessica Hopkins, Medical Officer of Health. Welcome.
Good morning. Thank you, Chair. So today I'm going to start by speaking about the global and local status. I'll provide an update on what we know about the virus to date, and then pandemic and transition planning. So with respect to global status, the cases continue to rise around the world with over 127,000 cases worldwide and more than 4,700 reported deaths. Indicators of significant community spread exist in a number of countries, including South Korea, Iran, and Italy. Numbers of new cases have decreased in China, and there are currently more new cases being diagnosed in countries outside of China. In Canada, as of 8:30 this morning, there are now 103 cases, with 42 of those in Ontario. As a result, the federal government has updated travel guidelines, now instructing anyone who has traveled internationally to self-monitor for 14 days after returning to Canada, and if they experience symptoms, to self-isolate and call their public health unit for further instructions. People who have not been contacted by public health and are well, meaning they don't have symptoms of COVID-19, do not need to call public health and do not need to present to healthcare settings for COVID-19 testing. So here in Peel, we have had 4 positive cases of COVID-19. All of these cases have either traveled outside of Canada or had close contact with another case. There is no evidence of community spread in Peel at this time. Now, there has been some confusion in the media about what community spread actually means. Community spread means that a person caught COVID-19 in Canada without international travel in the last 14 days to an area with COVID-19 activity or contact with someone who had COVID-19. All of the affected individuals in Peel are recovering in self-isolation. The situation we have here in Peel today was not unexpected given the global scale of this illness. So COVID-19 is a new virus, and health experts are still learning about it. Based on an analysis of tens of thousands of cases in China, we know that more than 80% of cases are mild. Most people will experience mild symptoms similar to a cold or flu, and only a small proportion of people will experience more severe disease. The World Health Organization recently reported that the global case fatality rate is 3.4%. This is between seasonal flu and SARS and is not expected to be the final number as the outbreak is evolving and the total number of mild cases who were not tested is not yet known. Looking at absolute numbers of people who've been affected, it's important to remember that influenza affects 3 to 5 million people per year and causes about 500,000 deaths per year. While the COVID-19 outbreak in many countries is still evolving, COVID-19 numbers are significantly below annual flu cases and deaths at this time. Yesterday, the World Health Organization declared COVID-19 a pandemic. Given the global spread of illness, this was not unexpected, and Peel Public Health and local health system partners have been actively planning for a pandemic. Pandemic planning has 3 phases. The first is containment, and then there's mitigation response, and then recovery. Presently, we are in the containment phase, which involves containing and eliminating the spread of the virus as much as possible. At this stage, public health aggressively follows up on contacts of any cases to ensure that we understand the transmission chains and aren't seeing evidence of spread in the community. We reinforce public education, such as staying home when you're sick and washing hands regularly, and we work with our healthcare partners, including hospitals, to develop plans to manage increasing numbers of people needing medical assessment and testing. Such containment steps are supported by federal border travel measures. Once community spread is detected, we expect to enter the second stage of pandemic planning called mitigation and response. The goals at this stage are to decrease illness and death as a result of COVID-19 and ensure that the health system continues to function. During this stage, public health authorities may implement public health measures such as limiting mass gatherings and other high-risk activities. This direction will be guided by the Public Health Agency of Canada and Ministry of Health. The third phase, recovery, will involve working to routinize the response for COVID-19, as you've seen happen with other public health illnesses such as West Nile virus. You will see us already starting some of this work. Following the lead of the Ministry of Health, Peel Public Health will no longer issue media releases for every COVID-19 case, but maintain an up-to-date count on the Peel Region website. Media statements will continue to be issued if there is a public health need to alert members of the public to potential exposures, and you've seen us do this around flights as well as a public transit exposure recently. Now that the Peel Region COVID-19 website is established and we can quickly update it, we are going to be transitioning away from our written council updates via email to the more transparent and efficient practice of keeping the website current. This will allow us to focus our energy and resources on containment, mitigation, and response. Everything I've talked about with respect to pandemic planning is a normal part of the emergency response work that we do all the time, and I want to assure you that we are in a good position with effective measures to prepare and protect the community. Now, effective Monday, my colleague, Dr. Lawrence Lowe, is going to take over as Acting Medical Officer of Health for the Region of Peel. This council and the residents, workers, and visitors of Peel will be in good hands under his leadership. Dr. Lowe will be supported by skilled and vigilant public health staff who are deeply committed to and capable of protecting health in Peel. I want to take this opportunity to thank each and every one of those people involved in the COVID-19 response for their tireless dedication, which has involved many late nights and few days off over the last couple of months. I couldn't be prouder of or more thankful for their efforts. Several steps have been taken to ensure Peel Public Health has a sustainable plan in place to support our COVID-19 response moving forward. This includes the reallocation of staff members to support our emergency response. To this point, this has been accomplished without any significant impact to public-facing services. However, as the number of cases increases, public health is now fully operating the COVID-19 response 24 hours a day, 7 days a week. To ensure sufficient staffing, we are reallocating a number of healthy sexuality nurses to support case management and contact tracing, really essential work for the containment phase. This means that healthy sexuality services will temporarily stop at our Brampton, Bolton, Hope 24/7, Malton, and Meadowvale clinics. However, we will continue to run the program from our multi-service clinic in Fairview. Existing clients are being contacted to arrange treatment or referral to partner organizations who can meet their needs. Nurses will continue to be available to support at-risk clients who are unable to travel to an alternative location. Additionally, infant feeding and oral health services will be reduced at the Brampton and Meadowvale multi-service clinics, with full closure of services at these clinics expected by March 23rd. We will continue to keep the Fairview Clinic operational for clients requiring dental screenings of an urgent nature. Dental screenings will continue at schools, and preventive oral health programming will continue at schools through portable and mobile bus clinics. Dental treatment for children in the Healthy Smiles Ontario program will also continue through our community health centres, and the seniors program is not impacted, as it is also delivered through the community health centres. These temporary service reductions are needed to meet the demands of COVID-19 and keep Peel residents protected. These services will resume as soon as staff capacity becomes available. I want to stress that public health units and our partners have learned tremendously from previous public health emergencies such as SARS and pandemic H1N1. As a result, public health experts, governments, and our health partners have never been more coordinated or better prepared to protect our population in a pandemic situation. Through the chair, I want to thank the Board of Health for the opportunity to serve as your medical officer of health. It has truly been a privilege. And I want to assure you that you will continue to be well served by a skilled public health team and by a committed leadership team when my term ends. Thank you.
Thank you, and well said. Before I go to questions, and I have a long list, the CAO, just to round out our efforts here at the Region of Peel before we take some questions. Nancy?
Thank you. Through the chair, I want to provide council with an update on how the region is preparing for the occurrence of COVID transmission within the community. So earlier this week, the executive leadership team met to discuss and prepare for potential business impacts should the virus become widespread. These impacts include but are not limited to business continuity, enhanced safety precautions for our employees, how we manage workplace policies as we respond, and ongoing communication with our partners in our local municipalities. In order to best prepare the region, we have activated the Regional Emergency Operations Center. So it is now activated to full capacity, and that was effective March 10th. This is in conjunction with the work that's underway with public health and in protecting our community health. By activating the REOC, I want to be clear that we are not declaring a public emergency. Rather, this step is to allow us to coordinate the region's work more and focus resources on the response of COVID-19. So in effect, it really does ensure that we are best positioned to manage the situation and allow for efficient response. As part of this activation, there are some staff who will move from their day-to-day roles to provide operational support full-time to the region and to the REOC, and this will be based on their experience and specialty. At the same time, we will continue to prioritize our day-to-day work to ensure essential services continue without any blip, if you will. Following this, we will continue to keep council apprised as this work moves forward. But for now, we are just setting up that regional EOC. All staff will receive a message today as well, sharing with them our plans moving forward. Thank you.
Nancy and Dr. Hopkins, thank you. Our questions. Councillor Santos.
Thank you. Through you, Chair, thank you very much for the update and all of the hard work, and thank you, Dr. Hopkins, for all of your years of work with us as well. I have a question about our first responders in all this. So we've heard a lot about the region and public health, but just an update on how our first responders are doing, if there's any impact on them, making sure that they have all of the equipment necessary. And I heard on the radio this morning that this is obviously something that requires cooperation and not a unilateral approach. So how are our first responders, paramedics, police and fire working together on this issue as well? So I know Chief Dundas is Chief Dundas is not here today. Okay.
So through the chair, thank you for the question. I'll start with speaking about police and fire because they're external services provided outside of the region. So we are very regularly speaking with those. And prior to the regional EOC being fully activated, there was a smaller activation that had occurred with the emergency management coordinators for the region as well as with the municipalities. And so those conversations are happening to ensure that those folks are supported with current infection prevention and control guidance. It is the employer who has the responsibility to ensure that their employees are protected, and public health supports that by providing the current guidance of what those appropriate protections would look like. So we're in constant conversation.
And maybe the CEO can answer on behalf, like, do we have info about Peel paramedics specifically? Because I heard the police and fire, but paramedics?
Yes.
I imagine that they would have.
Yeah, through you, Mr. Chair, thank you for the question. Yes, Chief Dundas is working with the staff on a regular basis to ensure that they have the equipment to be able to meet the response. He's working closely with Dr. Hopkins' team as well to ensure they have the most up-to-date data to be able to respond, and it certainly is a unified effort between staff and the senior management team. Move forward.
Okay, great. That's great. Maybe if Chief Dundas is here next time, we could ask him questions too.
Yes.
Thank you so much.
Thank you.
Thank you, Councillor Sato.
Thank you, Mr. Chair, and thank you for the information. Also, thank you for all your work as our medical officer of health. You have done an excellent job, and I'm sorry we're losing you. Wish we could tie you down, keep you here. You mentioned about moving staff. I have a couple of issues. First of all, you were saying about bringing in additional staff, shifting them around. Do you feel that if we get more cases, if the situation becomes worse in the region of Peel, that we do have sufficient staff to manage it?
So through the chair, thank you for the question. So yes, at this point in time, we do feel that we have sufficient staff. One of the things that happens over the course of an outbreak is the types of measures that are in place change. So while we're in the containment phase, we're really trying to make sure that we don't see community spread, that we don't see spread in high-risk areas such as institutions like long-term care facilities. And so that's why we so aggressively follow up with every single one of those cases and contacts in very, very high levels of detail so that we can make sure that there isn't spread happening outside of folks that we know about. Once you start to see spread in a community, that effort no longer makes sense because you've already know you've got spread happening. So you pull back from those and you start to increase some of the other measures that you might do, which is what I mentioned before about public gatherings, for example, really emphasizing social distancing as well. So it changes the level of staffing that you have. Currently, we've been able to do this response. So it's been up and running for 2 months now. And until I've told you today, there has essentially been no impact on public-facing services. So we shift our staff around in order to meet the needs. And we have a business continuity plan in place to be able to do that the same way we would for other types of emergencies, such as ice storms and things that would also interfere with our services.
Okay, thank you. With regard to large groups, because I know we're recommending to people to just avoid, what should we be advising our groups, like our seniors clubs, for example, where we get, up to 200 or 300 seniors meeting on a regular basis in our community centers? And I know we're doing a lot of precautionary methods in the centers themselves. But should we be giving advice to those groups to either not meet or, are we giving them enough information?
So through the chair, the Public Health Agency of Canada just issued in the last few days some guidance around mass gatherings. It's not a one-size-fits-all approach because it differs by population, such as what you talked about, seniors being more at risk. It differs by if it's an international gathering versus a local gathering. There are many factors that go into that. So later today, actually, Public Health, we plan to issue some guidance to municipalities who often are working in their economic development areas with different groups with their recreation centers to help them understand the considerations that should be taken into place when people are looking at any events that might be coming up in the near future.
Okay, thank you. What are you advising for, let's say, because Councillor Santos mentioned about service providers, emergency service providers, but what about employees at either any of the municipalities that have been in a situation where someone was tested positive? Should they be tested? And I guess the situation is, let's say a bus driver, we had the situation with the person that was taking the bus. Should those drivers be tested? Should they be isolated as precautions or not?
So through the chair, Public Health looks at every situation individually and what the exposure looks like. So people who are asymptomatic, meaning they have no symptoms, should not be tested. What we do is we risk stratify people based on their exposure. So if you, for example, live in the same house as someone who tests positive, those people are a higher risk, obviously, for getting the infection, and we would be asking those people to self-isolate. More transient exposure, where you might not have been as close to someone, we recommend that those folks symptom monitor for 14 days, and if they develop symptoms, they would self-isolate and be tested at that point in time. So we walk every case through, which is why it's so labor-intensive with all those staff to do this containment effort, because we talk to every one of those people individually and counsel them based on their specific situation.
Okay, thank you. And Mr. Chairman, the item that I'd asked to be put on the additional agenda, Councillor Paleshi was also going to raise it today as well during this, so I wonder if I could raise that at this time.
Yeah, I think it would be appropriate.
Okay, I think it is
Yeah,
appropriate.
absolutely. Carry
so
on.
the situation was that in the province allows us now to conduct meetings through electronic means. And we had been moving forward in Mississauga to allow that for our Accessibility Advisory Committee. We have the bylaw coming at our next meeting. Our city clerk said to me yesterday that she was suggesting that I move an amendment to the bylaw that would enable council to meet through electronic means in the case of an emergency situation. So if, and we hope this would never happen, if enough members of council had to be isolated, self-isolated, such that council could not proceed, that under, if we pass the bylaw, that we would then be able to conduct that meeting and still continue to conduct regional business electronically. So this morning I spoke with, this just came up yesterday, so I don't have a motion prepared, but I spoke with Catherine and Patrick this morning and asked if they could prepare a motion today for council. And my understanding is that Councillor Palashi, I guess Brampton discussed that yesterday. So I think we're on the same page. I think Brampton's directed their staff to prepare it. Now, I know it does require a bylaw, but we're not meeting until the middle of April. So I don't know whether we can deal with a bylaw today as an emergency measure. Hopefully, we would never use it, but if we did need to use it, it would be in place. So if, and I'm hoping over the last 20 minutes or an hour, Patrick has had an opportunity to think about it to see whether that's something staff could bring for us today.
Councillor Sato, thank you. What I'm going to do is this. I'm going to hold that to the second half of this presentation. I want to carry on with questions of Dr. Hopkins on the main subject she's brought forward. When I've exhausted all the speakers and we've dealt with it, I'll put this back on the floor and say, what further update do you have on the very good
That
point
would
that
be
you
fine.
raised? I think that may be a nice
Okay.
way to manage it. So
Thank you.
we'll be coming back to that once we've concluded this list and this main topic to the very appropriate point that you've raised. Mayor Crombie.
Thank you, Mr. Chair, and thank you to Councillor Sato. Our clerk raised this issue to us yesterday and suggested we move on it as soon as possible, should we be in a position that we may need to conduct our meetings virtually. So to Jessica Hopkins, Dr. Hopkins, thank you so much for your service. We're going to miss you. This is unfortunate, especially given the timing. So I hope this is somewhere really good that you're going, that you're leaving us behind, but you've certainly been excellent, and we've appreciated working with you. Last time we met 2 weeks ago, we voted to have updates from you every 3 days, but maybe we need to go back to the previous reporting structure of daily. Also wanted to know, so you'll just be posting information on the website. Will you continue to, or Lawrence will continue to write those memos to council or not?
So through the chair, what I'm proposing is that we just update the website. It does take a significant amount of
Okay.
time for our staff to do the daily, and so
Sure.
we can provide that information more transparently too, because right now it's only going to elected officials.
Right.
And we could share that with the public. So we've now got the website in a place where we can update quickly.
Okay, well, that's good. That's good news. And I wonder if you may update it a little earlier. We are getting the updates around 10:30 in the morning, and for us, we need to start our day a little sooner, and certainly our council meeting starts sooner, so we have the ability to discuss any news that occurs. You do not publish information on businesses that have gone into self-quarantine or lockdown or whatever, self-quarantine, let's call it that, as the bank had in Mississauga. And so we're reading that in the news, but not hearing it from our medical officer of health. Is that your policy, not to disclose businesses that are currently self-isolating, shall we call it?
So through the chair, there are a couple of different scenarios that can happen. So one is where sometimes businesses choose to do things that public health has not necessarily recommended. And so some businesses, for a variety of reasons, can make other decisions, and that's an employer decision. Public health generally only publishes names of whether it be an individual or a location if there is a public health reason that we need to alert people to that. So generally, if we are able to get the names of every single person and follow up with them individually, we do that directly. Otherwise, we do not publish the information generally in the media. However, if, say, for example, with the transit situation that happened with My Way, we needed a way to get in touch with people and alert them. The same thing happens with aircraft and flights often.
Right.
We need to get in touch with those people in a timely fashion. And the only way for us to do that is through the media. So there are different scenarios, but we will publish information when it is important for the public to know.
So this was an employer decision that those 2 floors self-isolate, go home and work from home, that we didn't report it.
So through the chair, there was no public health reason that we needed to share that information with the public.
And I think there are 2 in self-isolation in a senior's home from a visit from a potentially, an individual who potentially had the COVID virus.
So through the chair, we will not talk about individual cases to protect privacy.
Okay, and we're not moving forward with discouraging large gatherings at this time, as the NBA has suspended their games, or travel suspended from Europe.
So through the chair, what we will be doing this later today is Public Health has summarized the information from Public Health Agency of Canada, and we will be sending some general guidance out to the municipalities and working with partners who host a lot of mass gatherings. There are a number of factors that need to be considered. So for example, if there are a lot of international travelers coming from countries where COVID spread is wide, this may not be the time to hold those gatherings. If you are having large gatherings of healthcare workers that are critical to this response, this may not be the time to hold those kinds of gatherings. Each gathering needs to be looked at individually, though, so we're not saying cancel everything, but they need to be looked at. And the Public Health Agency of Canada provides some excellent guidance on the factors that need to be considered.
Given that the United States has just suspended travel from Europe, is it possible that many of those flights will be redirected, or those individuals will try to attempt to come through Canada instead? And what procedures are at place at the airport to screen people?
So through the chair, I certainly can't answer how flights might be redirected, but in terms of how screening occurs, and what we see now at the airport is an enhancement of the typical screening that occurs. So ill travelers on a daily basis outside of COVID-19, there's a process in place to flag people who might have a communicable disease of public health significance through quarantine services. What is happening currently is there is signage on the big screens alerting people, and at the kiosks on entry to Canada are specific questions that are asked of people and their travel history and symptoms. Should someone screen positive on those, they are referred to a border services agent for a more in-depth screening, and then they may be referred on to quarantine officers. Quarantine officers have broad powers in order to direct people to be assessed or seen by public health as necessary. Individuals are also provided with information on how to contact public health should they not have symptoms and then develop them subsequently. And then the Public Health Agency of Canada has been doing general media information to Canadians saying anyone with international travel in the last 14 days should self-monitor for symptoms, and if they develop symptoms, contact public health for further instructions.
Okay, thank you. Those are my questions.
Thank you. Perhaps on that, I see the commissioners. Commissioner Granger, did you have something on that point?
Thank you. Through you, Chair. I just wanted to mention about our long-term care homes because it was brought up. And this week we've enhanced our screening and our infection control measures, and those messages have gone out to all the long-term care homes within the region. We're also looking for ways to support both our paramedics and long-term care staff in terms of ensuring and advocating that they have the personal protective devices that they need. So we're working hard to make sure that, and supporting them if they have to go off on an STD or a sick leave as well. So working on all those issues as well. Thank you.
Thank you. Moving on, Mayor Brown.
Thank you, Chair. And Mayor Crombie asked a number of the questions that I was going to ask. And I imagine that when it comes to community gatherings, that when it's appropriate to shut them down, that you'll give that advice. Just reading some of the news where communities with rates that are larger than ours, but that they're saying no gatherings over 250, and then you're seeing some announced with no gatherings at all. And so obviously you're the health professionals. We trust your advice, and we will be looking for that guidance. I'd also note that one of the challenges we have is obviously you don't want people to be overly worried by relying on news that isn't accurate. I noticed last week there was a Facebook post about a coronavirus outbreak at the Walmart, which wasn't based on fact, but it got shared widely in the community to the point we had 100 inquiries into my office about that. And so we tell everyone that you update the community regularly if there are concerns, and that's the only source that the community should be looking to. How regularly, if there was an instance where there was a new case, how quickly would the community know so that we can tell them that don't believe what's being shared on social media? You can go to the to public health, and they'll be the first to post it. Is it fair to say that's a very short time frame in which you're able to communicate updates to the public?
So through the chair, once we're aware of an exposure in the community, that information is shared within a matter of hours. We get that out very quickly through our usual channels to share that information, and that's what's happened with the cases and exposures to date.
So if, for example, a local business, there was 10 people that had it, in no world would you keep that information private. You would post that immediately.
No, so through the chair, well, the first thing is, so if there's a case, the person who has the infection has to be notified first before, so that we can gather the information. Once we're aware of the exposure information in a setting like that, if it was important for the public to know, because the public could enter that setting, then yes, that information would be posted immediately. However, if this is a situation where it's a business and there's no one from the public entering the business, and we have the name and contact information of every person there, and we can speak to them one-on-one, then there is no public need to share that information, and we will not share it for privacy reasons.
Okay. We were told when we were studying the issue, the very herring issue of human trafficking, that one of the challenges we had in Peel Region is we are the gateway into Canada. And so as Mayor Crombie was talking about Pearson, are there additional concerns that you have? Are there additional measures that municipalities should be taking, given that we are such a gateway into Canada?
So through the chair, it's certainly one of the challenges that we face is just the number of people that come through Pearson Airport. It's a little city in and of itself. And we work really closely, though, with both GTAA as well as Border Services. We speak to them on right now an almost daily basis about things that are happening in order to make sure we're prepared, and we have a very strong collaborative relationship. So I feel very confident that they are implementing the public health measures as directed by the Public Health Agency of Canada.
My next question is a little bit trickier. Is there any advocacy that we should be doing? Obviously, we have the ability as city councils and regional council to do advocacy on behalf of our region, and I know you probably don't want to comment or may not want to in terms of we've seen other jurisdictions that have stopped airline traffic. You saw what happened in the United States last night. Would you want to weigh in on whether there should be any advocacy of having stricter entry points into Canada through Peel Region?
So through the chair, I can speak to what the evidence tells us because there have been travel bans that have been put in place. There were travel restrictions put on Canada during SARS. This can have significant implications. So first of all, that single measure in and of itself will not contain an outbreak. There are many other ways that people can get into a country. And one of the things that we want to do is make sure that people are correctly identifying themselves if they've been somewhere where COVID-19 exists, so that they can get appropriately assessed and tested. So border restrictions are only one measure that could be put in place. There are other significant economic as well as goods movement consequences for this. And so you do need to think about, there are specific supplies, for example, medications that are largely produced outside of Canada that we need here. When we think about the personal protective equipment, that is not manufactured here in Canada. It's manufactured in other countries. And so we still need an ability to import in order to make sure that we have the goods that we need. And so, yes, travel restrictions can slow down an outbreak, but they will not stop an outbreak.
Thank you. And lastly, I just want to say, I know it's been said before, but on behalf of the city of Brampton, just want to thank you for your dedication. I think we all feel sad to see you going on to another opportunity, but certainly you served here with such distinction, so thank you.
Hear, hear. Councillor Daskell.
Thank you through the chair, and I just wanted to, I guess, echo what everybody's saying, and that's you will certainly be missed. One of the really great things that I've come to chat with you about is you can take the most complex of situations and boil it down so somebody like myself can understand it, which is great. And you make it really easy for them, for myself to go out when people ask questions, to be able to answer in language that everybody is able to take in. So it's that has been very well taken in, especially at this time. And I just had a couple of questions just with regards to ongoing, if there might be some special liaison or something like that that is happening with, for example, I've got the Cawthra Senior Center in Ward 1 in Mississauga, and so we do hear from time to time. It's starting to get more active now as this gets into a bigger situation. But I'm just wondering if there is ongoing discussions there or a liaison type of thing.
So through the chair, we are working very regularly with the municipalities to ensure that information is getting distributed. We're working with school boards, childcare, retirement homes, long-term care facilities, and workplaces. We are doing our best to get the information out there, and I appreciate how much new information is coming on a daily basis. It's not easy for people in the general public to digest all of that, but we are working very hard to try and get that information out there for people so they can best protect themselves.
Okay, thank you.
Thank you. Councillor Downey.
Thank you, through you, Chair, and thank you for all of the information, Jessica. I think you've actually answered my question. Similar to Councillor Sato, I was going to ask about, gathering places, places of worship, and when they come to us and ask for updates and how they can best prepare and best operate, maybe not having a formal procedure surrounding that, how we can respond to them. So I think you've touched on it. If you'd like to repeat it, that's great. But other than that, I too would like to thank you for your service. And dare I say that these situations, as unfortunate as they are things that you kind of live for in your profession. So you've handled it well, and we can all see that. And I know I had the pleasure of attending the Alpha conference with Dr. Hopkins, and she was definitely a ray of light in that forum, and I was quite proud that you were part of Peel in that forum and the way that you represent Peel. So thank you very much for that.
Thank you. Councillor Medeiros.
Thank you, through the chair, and I echo everyone's sentiments, first of all, for wishing you well, and I thank you for all your service. Regarding, we talk about, just looking even in the gallery, so we talk about when are we going to, if their point reaches, what is the contingency plan around staff, around, for example, be it at our lower tier municipality or here, where it reaches a point that we start contemplating only having essential services to a certain degree and having people work from home. Because you're starting to see that already in the private sector. I hear it on the radio every day, people telling their work staff if it's not essential service or if it's work you can do from home. So what would be your recommendation, and are there plans currently at the region that will even help guide us at the lower tier municipality?
So through the chair, and I suspect you have these plans already at the lower municipalities as well, although one of our emergency coordinators may be able to better speak to that. But business continuity plans, most large organizations have those, and they're used for a variety of reasons. So this is just one of them, but, ice storms, labor disruptions, there are many different scenarios in which we prepare to dust those off and use them. When we look at, what those triggers might be, one is you have to look at what spread looks like in the community. So as we start to see community spread or localized outbreaks here in Peel, that may be the time when you start thinking, maybe staff who can work from home, will allow them to work from home. I also think at this point in time, all of the social distancing measures that we should be implementing. So, this week as I'm about to depart, I've been talking with a number of people and I've been having to say, I'm sorry, I can't shake your hand and I'm not going to give you a hug because of COVID-19. So, and that's something we should be doing right now, is probably not having as close contact with people as we normally would, making sure we're washing our hands. We had also shared yesterday some information, I believe, if it hasn't gone out to the municipalities yet, it's going out later today, about some advice around returning from March break. We have a large group of people who are probably going to be taking vacations, some of them traveling internationally, and so a reminder of the steps that people need to take to monitor their symptoms if they've returned from international travel, so that if they do have symptoms, they don't show up to work and spread it to people as well. The order in which you decide to stop or pause services or decrease service levels is really dependent on the individual organization. So, when I talked a little bit about what's happened in public health so far, we started out by delaying things that were not urgent. So, for example, work related to healthy eating and physical activity. It's really important, and in the long term, you all know we need to get on top of that for diabetes. But if we don't do some of that work for the next 2 months, it's still going to be okay. I need to shift those staff over to work on the COVID-19 response. We are now at the point where we've shifted so many staff from the non-urgent areas that we are now looking at some of our public-facing services like the healthy sexuality clinics. So every organization needs to look at the order in which they can decrease those things and the plan that they would have of what is the trigger for them, what is their minimum staffing level, what are the maximum tolerable days that the community can be without that service, and plan from there. So unfortunately, it's not a one-size-fits-all solution, but I would be, if I was an organization, I'd be really watchful for when community spread or outbreaks in the community start to happen.
Yeah, and I guess through the chair, my concern seems to be what, if you noticed in other communities, I guess were considered hot zones, it starts with that 2, 3, 5, and the numbers keep going. And when is the point that we're being negligent and irresponsible? Because as much as we've had increase in Peel regardless, and I assume that for every, I don't know what the ratio would be, for every one person, there's probably 10 or 15 that if we tested them that possibly could be. And again, I don't want to sound alarmist, but at the same time, how irresponsible are we? It seems like we're continuing as life is fine, and we look at the news and we see other jurisdictions and they're dealing with it. And when should we pull the trigger? And when should we sort of just say, well, no one in the galleries, start implementing measures like that?
So through the chair, that's such a good question. And one of the things that I haven't talked about with council is what we do is called enhanced surveillance. And so this happens through the Public Health Ontario lab. And so there are people who don't have exposure to an affected country, so they haven't been traveling internationally, they haven't had known exposure with a case, who are presenting to healthcare because they have respiratory symptoms. They're really common this time of year. In addition to the routine viruses like influenza that they're being tested for, those folks are now automatically being tested for COVID-19. Additionally, there's a program called the Sentinel Physician and Sentinel Hospital program that exists in Canada, and this is primarily used for flu purposes normally, where there are just docs out there who regularly test for some of these diseases in people who don't fit the travel history but present with the symptoms. And so this has been going on now for several weeks in Ontario through a number of different hospitals, and it's expanding the network across Canada. And right now they're not picking up any cases, and I was on a teleconference earlier this week and there had been over 700 lab tests done in Ontario for that group of people, 0 positive for novel coronavirus. So that's why when you hear public health officials talking about feeling pretty confident that there's no community spread at this point, That's why we're able to say that, because, you raised a good question of how do you know? Well, because we're testing people with symptoms who don't meet the criteria. And so we're watching very closely, and as soon as those signals start to be seen, then we're going to know that community transmission exists.
Okay, thank you very much.
Thank you. Something from our CAO on that point, then Mayor Crombie. Nancy?
Through the chair, and just to add to Jessica's response, that is the main purpose as well for fully activating the regional EOC. That group, which will be dedicated to this work, will go through our pandemic plans for each of our programs, as well as business continuity, to ensure that we are prepared. We're prepared today. We're also prepared for whatever may come weeks from now, and that will be working in close collaboration with public health. So we hope to get in front of this.
Thank you. Mayor Crombie.
Well, there's a bit of good news from the provincial government. Buried in their press release on COVID-19, Ford government says it's committed to fund public health units at 2020 levels in 2021, because we were bracing for the impact of the cuts. So in addition to extensive planning measures, Ontario is extending one-time mitigating funding for an additional calendar year for public health, which gives a 10% increase to municipalities' funding dedicated to these units. So that is a little bit of good news. I think that's everything.
Okay. That is good news, Mayor
Yep.
Crombie. Thank you. If I could, through the chair, just one follow-up question.
Chair, sorry, and that's in addition to the $100 million that they announced yesterday.
Very good.
Okay.
Just for clarity, because it was asked of me as well, and I'm going to use a ridiculous hypothetical example because I don't want to give one that might scare an industry, a community. So I'll use the hypothetical big Unica wedding coming up, which is not. It's hypothetical. But it was planned for the March break because my son's getting married. He's not. It's hypothetical. And we're from the Veneto. We're from the Veneto and the Lombardy region of Italy, and I've got 1,000 friends coming. And I've already booked all the hotel rooms, and the event was going to be at Sea Banquets. It's not. At what point do you have the right to tell an individual, a corporation, a gathering to say, hey, nice, but your boy's not getting married anymore. We are forbidding it because we are the entity that has the right to do so. Does anyone, do you, does the region, does the federal, just to be clear on if it gets to that point and some of the draconian things that have been done in other jurisdictions, for the fundamental point that the two mayors have raised, the international airport's in our backyard. Who and how would a situation, God forbid we have to cross that bridge, how would that be handled?
Through the chair, and appreciate that you're asking a hypothetical situation. Yes. So there are broad powers at the federal, provincial, as well as local level with respect to public health measures that can be taken. So at the local level, there is the Health Protection and Promotion Act, which is provincial legislation, and that empowers all medical officers of health with the authority to cause people to act or not act in ways that will protect the public. So this, for example, is how if there is a disease outbreak at a restaurant, you will all have seen in the past how we have shut down restaurants because of a health risk to it. This can be applied to other settings as well, including gatherings. So there is the legal authority to do that. There is a similar provincial and federal authority that exists as well.
Very good, and I'm glad we get the clarity because in the more realistic world, private citizens may not do what is in the greater good, and corporations that say, but hold on, all the bills are paid. If I don't have that event on the weekend, I go bankrupt, and they may take their own interests ahead of the broader good. We have the right to deal with those situations if they come forward, and I understood that to be the answer, but I wanted that on the record. Councillor Dillon.
Thank you, Chair. And so your hypothetical is actually true for my family. We have a wedding coming up for my younger brother in May.
And you're trying to make something up.
Yeah, right. And so I'm just trying to get some further clarification. It's on May 5th. It's in, there's a party in the Region of Peel. The wedding's in the Region of Peel. Somebody could say, you know what, we're canceling functions like this?
So through the chair, there are different ways that this could happen. So one is if the venue which you're holding this decides to cancel all functions, they could independently decide to do that. From a public health perspective, at May 5th, we're far too out for me to make any predictions about what the situation might look like here. At this point in time, we are not asking for people to cancel events such as weddings because we're not seeing community spread. And so your public health measures need to be commensurate with the risk in the community. I can't tell you what May 5th will look like. Should the situation change here and we are seeing widespread cases with a number of people impacted and outbreaks, we may be asking people to not hold gatherings such as this, but we will certainly be regularly communicating with the public as well as venues that host these as that time comes.
Right. So, I guess I guess that's what I kind of wanted to hear was that you'll be asking or even suggesting for, people not to hold these. But it's at Dixie Gurdwara, which is on Dixie and Dairy Road. And then there's a party on Airport Road. So there'll be about 1,000 people there. But Dixie Gurdwara itself, or Malton Gurdwara, which both fall in the region of Peel, there's Baisakhi coming up. They'll have easily no less than 1,000. You'll probably be looking at maybe even 5,000 to 10,000 people there. Are there conversations that we could have directly with them? Because the dates are coming. The wedding season's coming no matter what. Can we have those proactive conversations with them?
So through the chair, as I mentioned earlier, that we are going to have some messaging going out later today about this so that people can look at the Public Health Agency of Canada guidelines around this. One of the challenges that we face right now is just in terms of resourcing to have all of these individual conversations. We are literally having hundreds and hundreds of calls into public health right now. And there is a high level of public health skill that is required in order to have a detailed risk conversation. So at this point in time, we do not have the capacity to have individual conversations. However, what we try to do is go to larger organizations who can then have the conversations in gathered venues, such as through the municipalities and economic development is one area because they do a lot of work, through, say, the Mississauga Convention Center that hosts a lot of these. Those are the types of conversations that we can have so that we can limit the number of resources that this is going to take, because for every single wedding that might come up, we just don't have the capacity as much as we would like to have individual conversations.
So if we can convey the message that we've been provided, that should suffice, correct?
Through the chair, we will be happy to share that information with councillors so that you can share it as you get questions as well.
Yeah, appreciate that. Thank you.
Mayor Crombie.
Thank you, Dr. Hopkins. There was some suggestion as the warm weather approaches, I don't know if it's mythology or false information, but it's circulating that as the weather warms up, the virus may die off. Is that any accuracy in that statement?
So through the chair, scientists don't know yet. So
I
this is a
see.
new virus. It only appeared in, they think, late November, early December. We haven't seen how it behaves with the seasons. There are many viruses that show seasonality, but we don't know at this point in time if this will be one of them.
Okay, but other viruses do, so there's potential. Okay, thank you.
Councillor Sato.
Thank you, Mr. Chairman. I was just pointing out to staff that I was unable to get on to the Peel Health website, and I've tried on several devices, so have clerk staff. It looks like maybe the website is not opening. So I guess it's a little bit of a concern, because if we're posting information and we're sending people to the region of Peel Public Health and we're not able to access it, perhaps staff could ensure that, even if we have to move the Peel Health off the website and put it somewhere else, we need to be able to get people to that site. I thought it was just my mind, but I I asked clerks, they've checked on their devices as well, and the site's just not opening.
So thank you for drawing it
So-
to our attention, and I see the faces telling me we're looking into it as you
Yeah.
speak.
And Mr. Chairman, I didn't see anyone else on the list, so I wonder if we could bring that motion.
Will, and I was a little, Sean may have something on the very point you've
Oh,
just
okay.
raised.
Yes, I just wanted to confirm that we're aware of the issue and looking into it right now.
Oh,
So
okay,
we'll have
good.
it up and running immediately.
I wasn't imagining it. Thank you.
Okay, and yes, Councillor Sainer, having had an excellent conversation on the main subject, I now come back to the point that you raised about what can we do to mitigate our own risks, voting electronically, et cetera. You've put the suggestion on the floor, first through to staff. I don't know if it's through to Patrick, first, and staff. Let's have that
Yeah,
conversation now.
Patrick's been working on a motion and bylaw that we can deal with.
Very good. Patrick, you're up.
Thank you, Mr. Chair. We are continuing to work on a motion for that purpose. We think we can draft it in a way that permits the matter to be dealt with today through enactment today. And I am still on the wording, so perhaps I could bring that back later in the meeting.
Yeah, that'd be great. Thank you.
Very good. Thank you. All right. So with that, before I call for receipt of the presentation, I do want to take this opportunity on behalf of council to acknowledge that this is Dr. Jessica Hopkins' last day at the region. You know, one thing you have to get used to as the regional chair is people poaching your staff. Because we have very good staff, and as a result, they're taken from us, which is bittersweet. It means we have darn good staff, and we move them on elsewhere. So, as our medical officer of health, Dr. Hopkins has made significant contributions to the region over the past 2.5 years. She's worked tirelessly to improve the health of Peel's community, overseeing such areas as health protection, promotion, and disease prevention. She has led a number of critical initiatives, including the renewal of the 10-year Public Health Strategic Plan, leadership on opioids and mental health, and she's helped us navigate the modernization of Ontario's public health system. More recently, she has shown exceptional leadership skills as we continue to monitor and protect the community during the COVID-19 pandemic, as you've just witnessed. And these are just a few of the many contributions that Dr. Hopkins has made to Peel community over the years. We thank Dr. Hopkins for her excellent work that she has done to improve the health of Peel, and we wish her the very best in her new role as the Medical Director of Health Protection at Public Health Ontario. Wow. Yeah. And the last thought that I would have for you, it's an old anecdote that I learned many, many, many years ago when someone is stressed or, oh, let's get up, let's formally get up and let's do that. Yeah. Thank you. And I was going to say the fondest memory that I will have of you is an anecdote that I learned many, many years ago when someone's traveling abroad and you're concerned because you're in uncharted waters and you're in a taxi cab, for example, and you haven't seen this community, it scares the life out of you. And what they tell you is, look at the cab driver. If they're calm, you're okay. If they're phoning home and say, I love you, dear, kiss the kids, you have a problem. You're the calm cab driver. That is your greatest attribute, and you saw it again this morning. And it served us well, and it will continue to serve you well, and you'll be sorely missed on behalf of council. Every success, and quite a promotion, I might say, and deservedly so. Thank you once again. Okay, Madam Clerk, with regards to item 8.1, is it here for receipt? A show of hands to receive the presentation, knowing that a motion's coming later on the point that was raised. All those in favor? That is carried. Thank you. Item 8.2, Development Charge Interest Rate Policy Bill 108, presentation by Stephanie Nagel, Treasurer and Director of Corporate Finance. Welcome.
Good morning, Chair and Councillors. Today I'm providing a brief presentation on the proposed interest rate policy for development charges. This addresses the new legislation under Bill 108 in relation to providing for DC rate freezes and payment deferrals. With me today is Maggie Wang, Manager of Financial Policy and Development Financing. The recent changes in legislation from the province on DCs are as a result of their initial announcement during 2018 in their fall economic update that the Ministry of Municipal Affairs and Housing would be launching a housing supply action plan with the purpose of increasing housing supply by addressing barriers that inhibit the development of ownership and rental housing. Then in May 2019, Bill 108, the More Homes, More Choices Act, was introduced. This legislation made significant changes to the Development Charges Act. Since then, we have brought forward 3 staff reports to Council that have identified impacts of this legislation and all of the changes. The stated objectives of this bill is to increase the supply of housing. The region supports this goal, which is shown through our Housing Master Plan approved by Council in 2019 and the region's initiation of Affordable Housing Incentives Pilot Program, among other programs. However, some of the impacts of the new legislation do impose risks on the municipality, which I will speak to later. In the review of the Bill 108 and its implications, the province acknowledged that municipalities may incur some additional costs as a result of the new legislation. And for that reason, legislation provides authority for municipalities to charge an interest rate to cover costs associated with each of the prescribed policies for both one rate for deferral and one on the freeze, essentially one rate per category. In determining a policy for the region, the setting of the interest rates was guided by balanced principles, including, but not limited to, that growth should pay for growth. Secondly, that the interest amount charged should cover costs associated with servicing the growth. A third principle was to provide an appropriate level of predictability, stability, and reliability to enable the region and the development community to determine the timing and the amount of development charges. And finally, to support Council's priority for affordable housing. The regulatory changes to the development charges collection create a significant time lag between when revenues are received from developers and when the cost of growth-related infrastructure needs to be incurred, leading to a wider funding gap. The proposed development charge interest rate policy aims to mitigate financial risks for the region, to support an increased supply of affordable housing, and to provide a measure of predictability for both the region and the development community. So first of all, I'll speak to the DC freeze component. Under the new legislation, the total amount of a development charge for a development that is proceeding through a site plan control or a zoning bylaw amendment approval is subject to the freeze on the DC rate. The DC rate would be determined when the application is made and would remain in effect for a period of 2 years from the date upon which the application was approved. The amended Development Charge Act also provides for the deferral of payment on certain development types for rental housing development that is not nonprofit housing development and institutional development, both to be paid over a 5-year period in 6 installments, as well as for nonprofit housing development paid over a 20-year period in 21 installments. It is worth noting that originally, industrial and commercial developments were eligible for a deferral. Regional staff, along with others in the municipal sector, have advocated for changes to Bill 108. The province has been receptive to some of this feedback, and as such, those 2 types of developments have been removed from the development charge deferral eligibility. This allowed the region and others to take a look at supporting of increased rental supply and development of affordable housing. We are proposing a DC freeze interest rate of 5.5% per annum to be applied from the date of the site plan or rezoning application to the date the development charge is payable. The proposed rate reflects a forecasted annual rate increase in order to cover the costs associated with the freeze. Financial analysis conducted by staff considered many variables, such as infrastructure cost inflation, the region's growth forecasts, and economic outlooks in capital markets. The rate is anticipated to remain constant for a period of time, with a review conducted at a minimum with each new background study update. A fixed rate provides a measure for certainty for developers and an ease of administration for the region. Currently, regional development charges are subject to biannual indexing on February 1st and August 1st of each year. Given that the development charge rate would remain unchanged between now and the next indexing rate, regional staff are proposing a grace period during which the DC freeze interest of 0% will be applied if the building permit is issued prior to August 1st. This will prevent the introduction of an interest charge from having a punitive effect. The deferral interest rate discussion is in support of affordable housing initiatives. As noted, the affordable housing crisis is currently being addressed through various levels of government, The Region of Peel has acted by approving the 2018 Peel Housing and Homelessness Plan, which sets direction for the work of the region and Peel's partners. The plan identified a need for private sector development of purpose-built rental housing. Further, to advance Council's affordable housing priority, regional staff are recommending that a DC payment deferral interest rate of 0% per annum be applied for a development that is eligible for the regulated deferral. Development will continue to be funded through DC rates with no impact on the tax base from this policy. It will all be funded through the growth and the DC rate. For next steps, staff will continue to engage affected stakeholders to implement the DC interest rate policy. In addition, the Building Industry and Land Development Association, known as BUILD, was informed of the policy's guiding principles at a meeting hosted by the region on January 27th. In a meeting on March 3rd, staff shared with BUILD the proposed DC interest rate policy directions. Staff will continue to dialogue with the development industry to work through implementation requirements resulting from Bill 108 and to promote development charge deferrals to support an increased supply of affordable housing and rental stock. Over the next several months, regional staff will continue to collaborate with local municipalities to implement the DC interest rate policy and to enhance the development charge collections processes. As you are aware, the region's 2020 development charge bylaw is currently underway for update for October 20th, 2020, and the background study is expected to be tabled to the public in this June timeframe. A new item has arisen since the writing of this report, so I will provide a quick briefing at this time to keep council informed. On Friday, February 29th, the province posted regulations in relation to the new community benefits charge, the CBC. While staff are positive, have seen some positive changes, we still have concerns and as such are working on a response to the posting, which is due March 31st. Given the limited 30-day time frame for response, staff will report back to council in April, similar to what we have done with the past responses on this new legislation. Thank you for your interest in this discussion on this proposed policy, and we're happy to take your questions at this time.
And there are. Councillor Parrish.
I actually don't have questions. I'm going to let you know what our staff thinks of the proposal. As usual, the City of Mississauga finance staff don't like 0% interest. And I just ignore that usually, but they came up with some really good reasons. They agree with the 5.5%. They support that. I'll read exactly what they sent to me. City of Mississauga finance staff are not supportive of this proposal. That's the 0%, because the 0% interest rate would also apply to luxury rental development and private for-profit retirement facilities, which does not advance the affordable housing priorities of regional council and provides a financial benefit to these developments. Staff are working on the financial impact and expect to send it to me, which they did. And they took 8 recent applications, and it's a loss of $5 million, and none of them are affordable. So what I would like to do, and I've got this, and I will give this to your staff to have a look at, but I would like to just defer this, send it back. We're working on our new DC regime. Obviously, the region's working on its new DC regime. This should all come back together, and then we can look at these ramifications. Our staff's happy to come up and sit down and chat with the staff up here to make sure we're consistent. We don't want to have it at 0% here and we're still charging, nor do we want to lose the money that we will be losing. So I've got this analysis, which I'm happy to share with you, but at this time, I would hope we could delete or defer the bylaw 21-2020, which is later in the agenda, and bring it back once all this has been looked at and our staff's been informed and come up and chatted with your staff.
Staff, very good points raised, by the way. Staff, the immediate response on first blush.
Yeah, absolutely. So it is, you know, as you say, finance people, and myself included, generally don't go for a 0%. And so I guess if you let me, I'd just like to provide a little bit of background on kind of how we got to that. And I think that might help the discussion if anybody else has any questions as well. and we'll take council direction as provided at this meeting and move forward. We have had discussions with the local municipalities, and I think in our discussions, some are in different places than others in terms of where they are in forming their development of a policy. So we did share this with them in advance. They knew what we were bringing. But from that impact, I mean, everybody has to determine their own impact and move forward. What we looked at, so I started looking at this policy, not looking at 0%, I'll be honest. And when we looked at it, we were looking at, do we charge, the same rate on deferral that we charge on the freeze? And there's different pieces in play there. Many municipalities are working on their policies right now. Some have implemented 0% on the deferrals, some haven't. Some have implemented them the same as the deferral. But it's still early in the days of these policies, given that the legislation, the regs dropped in December right before Christmas, so people were scrambling. When we started to look at this, the first thing that we looked at was the fact that we couldn't charge a different rate on deferrals in terms of within the categories, that if we have a rate for deferral, it's one rate, and a rate for freeze. It's how the legislation is written. I mean, there might be people that challenge that, but that was our legal opinion that we got. So then we started to look at, do we do a zero or do we not? There's valid points for both, and I think in looking at it, part of it was we did look at, we collaborated with housing and planning and local municipalities and other municipalities across Ontario. And for us, there is a rental vacancy issue. So although there is a component and there could be higher end rentals that benefit, that part of that would increase supply, which then institutes at least more supply of rental housing. And there might be people who move up into more luxury units and make room in the middle. And there might be a lot of middle income units that come forward as well, which is an issue that we've seen too. So the supply piece came up as well as the piece on affordable housing and the initiatives we're trying to take with the affordable housing builds on the nonprofit side. So we couldn't do a 0% for the affordable housing and then have a rate for the private because they're in the same category.
Can I ask you a question on that? We have here and at the city forgiven DCs. In fact, we haven't forgiven them. We've given them a grant in lieu of. Is there not some way you could incorporate that into this and look at what's being deferred? If it turns out it's an affordable unit, we give them a grant in lieu of the interest rates. And the ones that turn out to be luxury buildings, and they will all take advantage of it, don't get the grant.
Yeah, so to that point, and through the chair to Councillor Parrish, we did look at that, and I think so. It's a very key point in the analysis. So, the way we've written the policy right now, the deferrals actually get funded through the DC rate rather than through the tax base because of how the legislation falls. So, growth continues to pay for growth. The DC, any additional or earlier debt that we would have to take on actually will get funded through the growth mechanism rather than through a tax grant. If, to your point, we could, if we wanted to do so, we could put an interest rate on the deferral and then exempt the nonprofit. That exemption then has to be funded from the tax base. So it's a clear difference in terms of the policy. And that was one of the reasons why I actually changed my original opinion, was because we could fund it through growth by keeping it within the DC policy and the guidelines. Once you do that piece where you're providing an exemption outside, you do have to fund it from the tax base. And to the other main point we looked at throughout this whole piece was just the administration piece. If we add layers of administration on looking at the building types, do they have, how many affordable units, how long do we track them, the whole 20 years, it will increase costs, and we do have to look at that.
What our guys have said is it'll potentially delay capital projects because of the infrastructure shortage. We're having to replace pipes. We do all the same stuff everybody else does, even though we're almost built out. I guess what I'm asking today is, you're giving me very good explanations, and I'm worried about unintended consequences. I'm also worried that our finance people always say no. They're abominable no people. and we hope they do on most occasions. And I am the housing queen. Bonnie and I are the two at our board. So all this makes perfect sense to me. All I'm asking you to do is delay it, consult again with our folks, convince them if you can, and take into consideration what their concerns are and maybe address some of those and bring this back. I'm not saying no. I'm just saying help us convince our people.
Through the chair to Councillor Parrish, I absolutely, they're excellent questions, and working together is always the plan. The only thing that I'm cognizant of is timing, given that, kind of once we hit that August 1st timeline for our next indexing, we won't be able to do it.
Nothing makes people work together more quickly than a set killer date. So that gives you till August. I would say let's defer this for 3 months and see if you can get together with the Brampton financial people, because I'm sure they're going to have the same questions, and the Caledon people and the Mississauga people. And if it comes back exactly in the state it's in, I promise I'll support it. But our job here, we are really taking it very seriously lately, having our staff look at all the agenda items on the regional agenda, because there's a big chunk of money gets spent up here. So we have to take their cautionary tales seriously. So I would find out who keeps, Nav Bhatia keeps calling me because the canceled basketball game and 400 tickets he bought for one of my high schools. Go away now. I got your money. I don't need you anymore. Don't say that.
Well, I'm glad we kept that secret.
Can you give that to Mr. Off?
So through the chair, I think the last meeting for council is in July, so that might be the direction if there is a recommendation.
Yeah. Two thoughts before I go to Stephen. Let the record show that it was at 11:06 on Thursday, March 12th, that Councillor Parrish said we need the regional staff, the great regional staff, to make the Mississauga staff do the right thing. So this is a big day. Thank you.
I'll get into big trouble over that.
And Carolyn, in fairness, your points are very well made, and I'd considered some of them myself. The question I have is, if they've made up their mind and we're trying to convince them and we've gone this far and they were aware every step of the way, what's the delay going to get us if they've made up their mind, and recognizing they're your staff, and we would hope the Mississauga councillors would have more control over our staff than ours, but still very legitimate. I just want to make sure we're working towards something. Perhaps Stephen Van Offweken can help me out.
Thank you, Chair. Just one of the things that, and I think Stephanie mentioned in her presentation, and a couple of other municipalities, like the York Region, have also adopted a similar interest rate policy. We do recognize that as we go through this, we will learn more as we get real live data over time, and what we are proposing is at a minimum that we report back to council with an update to the policy with each DC bylaw update, but also that certainly in the first year or two, we'll start to learn a lot more. And one of the things we've tried to do through the policy development is keep it simple to start, take the baby steps, and then from there, if there is unintended consequences, we do recognize that there will be some luxury rentals built into the system. But as Stephanie mentioned, and certainly to our planning folks and housing folks, the comment there was that as you increase the supply of all rentals, people are able to move up to a higher quality rental, which frees up more affordable housing. So although that particular development may in of itself not be what we're intending, it's the ripple effect it has on other units that get freed up in the more affordable housing market. At the end of the day, the costs that are incurred or not incurred are funded through the development charge rate. Any other proposal would result in a tax increase.
Okay, through you, Mr. Chair, to Mr. Von Offweken. You're suggesting we review it in 2 years and figure out if there are unintended consequences. I'm saying delay it 3 months, have a good solid look at it, and then do what you suggest in 2 years. I think putting the horse before the cart, I would like a 3-month respite or a couple of months for us all to get together on the same page.
If that's council's wish.
I don't know if it's council's wish, it sure is mine.
Councillor Perry, because I think it's a very legitimate point. If I can ask the question this way, with the, if council were to vote in terms of a deferral and come back in 3 months, what would you try to achieve? What would you hope to achieve? What levers do you have? What levers do you, because it's being directed to you. So if council finds favor, what would you hope to achieve? Just so make sure we're not spinning our wheels here. Go ahead.
Through you, Mr. Chair. That is a very good question. I think we have to go back and really talk this through. I don't know that we got that quite the same response when we were talking to staff about the policy. And I think probably the reason as well is that, the regional level policy doesn't have to have the same pieces as the local. And there may be different principles or different guiding factors that change what people are doing. In terms of, there's a lot of collaboration we can do, but I mean, we have been discussing the policy. Maggie's worked with the DC managers across all 3 municipalities, so that we hadn't really received anything on the negative impact on the 0%. And again, if the local level doesn't choose to do that, they don't have to follow the same policy as us. So it would be a regional issue rather than a local issue. I know Steve mentioned the York region case, and I believe in York, they are, York's passed their policy. It's very similar to ours. And we've seen others. Durham is not charging on deferrals. I believe Toronto's not charging on deferrals either. So there will be people who charge on them and people who don't, and there's different reasons. I don't know that we'll get to the same policy in the end. We may align more closely to some and not others, but we have had conversations, so I'm not exactly sure what the outlying piece will be. It is good to get legislation in place earlier. Part of the reason we were bringing it now and the August 1st is our indexing, but it also gives us time to work with the locals on collection and how we're going to run through those processes, right? There's a lot of process change in DC, and this is just one other factor. So, the locals, and my understanding is they're looking at some variable rates instead of a fixed rate on the other side. So where we're looking at the freeze, we've instituted a fixed rate, but I believe Brampton and Mississauga are both looking at a variable rate, which will then change with markets and different things. And we have a reason why we went with the fixed rate, and we understand their reasoning for their other piece. But I don't, if we're trying for alignment, I'm not sure that we'll get alignment per se. But we're always happy to talk to the locals in terms of why we're doing the things we're doing and how we came to that piece.
Okay, well discussed. Councillor Parrish, would you like to make a motion?
I would like to make a motion that we defer this for 3 months to give all the finance and planning and T&W people from all the levels to get their heads together in a room and come up with something that will work for all of us. If it doesn't work, it doesn't work.
Okay, and 3 months being exactly, if I could attach a date to it, that it has to come back just to... Before July 9th is what the clerk is telling me? That works, just so we know.
That's fine.
Okay, so you've heard Councillor Parrish's motion. Do I have a seconder for that motion? For deferral, it is Councillor Starr. Madam Clerk, you need a recorded vote, regular show of hands. So, and I'm going to need to see the hands clearly. You've heard the motion, properly put by Councillor Parrish and Councillor Starr. Show of hands, all those in favor. No, it's not, apparently. And I think that carries comfortably. Very good, thank you. Moving on, item 8.3, Neighborhood Information Tool, Data by Ward. Here for information, presentation by Sandra Solonik, Advisor Community Engagement, Sheen Dako, Manager Business Intelligence, and Kevin Ferrugia, Advisor Digital and Information Services. Welcome.
Good morning, Regional Chairman and members of Council. I'd like to request an additional 5 minutes if possible so we could also include a demonstration of the Neighborhood Information Tool. Thank you.
So moved.
In partnership with the City of Brampton, City of Mississauga, and Town of Caledon, the region has developed and launched an online data tool focused on providing evidence-informed lens to better understand our neighborhoods and inform planning and programs and services to meet the needs of residents. Item 8.3, a report titled Neighborhood Information Tool Data by Ward provides data from this tool, outlined by ward boundaries as requested by Regional Council. This presentation provides an overview of the tool and the data you have been provided.
Peel's Neighborhood Information Tool was adapted from the City of Toronto's Neighborhood Equity Index. The tool was developed through partnership with municipalities to enable greater understanding of Peel neighborhoods in terms of opportunities for investment and resource gaps in different communities across Peel. The Neighborhood Information Tool combines qualitative and quantitative data for 21 indicators grouped into 6 domains to provide a neighborhood well-being index score displayed in a geographic map. The tool provides insights that enable a stronger understanding of community needs to inform local planning and community investment decisions. As referenced earlier, the Well-Being Index is a combination of variables to produce a measure or score of neighborhood well-being. The higher the well-being score, the better off the community or census tract. The 6 domains that contribute to neighborhood well-being are social demographics, economic opportunity, resident engagement, community belonging, safety, health, and physical environment. Within each domain are the relevant data indicators. The data sources for this index is Statistics Canada and Environics. As well, we've also gathered data through partnership with Peel Regional Police for the safety data and Ontario Provincial Police as well. The Wellbeing Index Score methodology enables municipalities to look at cross-census tracts through the same domain or data indicators and identify which neighborhoods may benefit from greater discussion or exploration. The tool is online within the Peel Data Center platform. It is intended to be a user-friendly format for the region and local municipalities as well as service providers to help better understand the communities that we serve and inform planning.
So now I would like to provide you with a demonstration of the online tool. But before I begin, I'd like to thank Councillor Sato in supporting the demonstration by supporting us in selecting census tracts or neighborhoods within her ward. So as mentioned, the Neighborhood Information Tool can be found on the Peel Data Center's data portal. The portal has a variety of information related to data. Here is the tool and maps icon. And when you click into the icon, the Neighborhood Information Tool appears to your right, as well as a lot of other amazing resources that are data related. You just click on Use the Tool, and you come directly into the Neighborhood Information Tool. It's just spinning, I see, for a few minutes, but there is an information page that pops up shortly, and that will provide very similar information that we provided through our presentation today. The Neighborhood Information Tool is designed to look at each municipality independently, as municipalities are unique in their geography, infrastructure, populations, and neighborhoods. There's a tab for the City of Mississauga, City of Brampton, and Town of Caledon. To the right is the map legend. What you're seeing on the map is the census tracts, as well as the shading related to the Wellbeing Index score, which can be found in the legend. The lighter the shade of purple, the less well-being. As well as there is a list of assets. The assets are not an extensive list. However, they are assets that do align to the 6 domains. You can select as many assets as you desire to understand their locations, and they start to appear. As well, so we have the ability to include ward boundaries. which is slowly coming. We have a bit of a delay. There we go. But as you can see in this map, it's very difficult to navigate. However, you have the ability to zoom in. As we zoom into the Mississauga map, more streets start to appear, as well as shadings to show buildings, parks. It helps you with navigation. As we hover over an icon of an asset, the name of that asset will pop up. You can click on the asset, and the address and contact information will be there, as well as when it is available, a website link. As you hover over the various census tracts, they become highlighted. And what you will see pop up is the census tract number, as every census tract across Peel has its own identifying number, as well as the score for that area. Related to the appendix in Report 8.3, the NIT data charts that you have included also reference some navigation factors. So when we look at this census tract, you will see that it actually borders 2 wards. Sorry, as I highlighted. So that is recognized in your data charts with an asterisk. And that information or data for this particular census tract would be included in both of the charts for both wards. As well, when we look at a certain area and select it, some areas obviously have a large industrial or commercial area. This is noted when you select the census tract because those factors may affect the index score. As you select a census tract, the population, the score, and number of dwellings is viewed. So let's select 2 census tracts and look at the data. This census tract here has a score of 80. You can just click select. And we're going to look at a census tract with a lower well-being score of 45 by selecting. We can shrink the map and then look at the individual indicators for both those areas. What's also included as a comparative is the local municipal related data for each indicator. So we see the population and number of dwellings, but we also see that in comparison to the city of Mississauga. The data is divided by each of the 6 domains. At the bottom of the data are the definitions of each indicator as well as the sources. So just to highlight a few differences when you look at these 2 areas. To the far left is the census tract number. Because it's the number, when you're navigating the chart, it's always helpful to have that noted. But the one on the top, this one here, is the census tract that had the score of 80, and the one on the bottom is the one with the score of 45. However, when I look at some factors like mobility status is the proportion of population who have moved residence within the past year. The lower score or low well-being area has a greater mobility status and much greater in comparison to the city of Mississauga. As well as when I look at lone parent, the low well-being census tract area or neighborhood has a higher percentage of lone parent families, greater than the other area I selected and greater than the city of Mississauga. As we continue to look at the next domain of economic development, we can look at prevalence of low income. Prevalence of low income is based on the 2015 after-tax income measure, and we can see that the low well-being area has a higher prevalence of low income in comparison to the other area, as well as in comparison to the city of Mississauga. Similar to household shelter costs, the prevalence of household shelter costs or households that are spending greater than 30% of their income on shelter costs is greater in the low well-being area than it is in the other, as well as the city of Mississauga. Resident engagement and community belonging includes an indicator called Sense of Community Belonging. That is data that's gathered through the Canadian Community Health Survey and is the proportion of population 12 plus that have supported a sense of low community belonging. There is a greater representation in the top of the chart here, which is actually the area of greater well-being overall. What's important to note, even when you look at the map and you see an area that has a dark purple shade, so greater well-being based on the 21 indicators, there are still portions of that community that may have needs, or there are specific data that would be valuable to review to better understand that community. Recreation program usage and library usage are indicators we receive from the local municipalities. The library usage and recreation usage is really strongly connected, we find, with if that census tract has those facilities directly within them. So it does make sense the lower well-being census tract area does have those facilities, so it is showing a slightly higher usage compared to the other area. Health and safety. We have the crime rate data from Peel Regional Police. In relation to the city of Mississauga, both areas report a lower crime rate than the city, as well as healthy child development is around are children ready for school. And what I'll do is just scroll down a little bit more so you can see the definitions. That's the proportion of children who are vulnerable or not school ready. There is a greater percentage in the area with low well-being than there is in the well-being area. However, 18.37 is still a percentage that you'd want to pay attention to. As well as the self-rated health is the proportion of population 12 or older that rate their health as fair or poor. The proportion in the low well-being area is greater than the city of Mississauga, but also is the rate in the high well-being area is also greater. The last domain is physical environment. This is related to proximity to fresh food providers, proximity to community meeting places, as well as housing conditions. We can see the proximity to fresh food is better off in the well-being scored area, as well as the differences with the proximity to community meeting places. There is a community center and several other resources or centers, such as places of worship in the low well-being. So it has 100%. And that's based on a 10-minute or 800-meter walk for the majority of the population. Housing conditions are slightly worse off in the number that require major repair in the low well-being area. We'll just click back to the population, or to the PowerPoint. Overall, as you're looking at the, sorry, I'm just going to click through. There we go. Overall, the neighborhood well-being tool is just a tool to understand where we need to ask more questions, where we need to look closer at communities. They are based on census tracts, and we know that naturally within those census tracts, there are smaller communities. At the time now, this data is available in the most credible form at a census tract level. As we move forward, our focus will be on sharing the usability of the tool to ensure people are aware of the tool and how to use the information to inform their planning. As well, we will be sending an invitation to your municipal peers and yourself, to staff, as a training invitation to help yourselves and your staff become more familiar with the tool. You'll see that shortly in email. Planning, this tool has been used to support various internal strategies related to housing, early years, etc. And externally, nonprofits are using it to inform where they need to expand services, or also are pulling the data to inform their grant applications. The region has several maps and tools that are available, and as we move forward, we're going to look at opportunities to amalgamate or integrate maps where possible. To wrap up, the NIT is a consistent approach to looking at the well-being of Peel's neighborhoods. Currently, Peel has 245 census tracts, And of those, 57% rate high or moderate high. That's a very strong positive. And our goal is, as we update this tool, the majority of the data is available through census, and the next census is in 2021. As we update the tool, we will be keeping a snapshot so we can look at trends over time. The region appeal, as we move forward with our strategic plans and priorities around community safety and well-being, our poverty strategy, our appeal homelessness and housing, as well as our early years and child care plans, will help contribute to the well-being of neighborhoods. Thank you.
Thank you. And there are questions. Councillor Sato.
Thank you. And thank you for using my ward. That was very, very educational, very informative. So as I looked at the chart, I was actually looking at the data that you provided to us. And how does the overall ranking, how is it influenced or weighted by each of the items that is here? So I'll give you an example, one that kind of jumped out at me as a bit of an anomaly, and I think it's probably throughout. So I looked at one of the areas that has an index score of 70, for example, and I'm comparing it with the one that has 45. So when I look at prevalence of low income, I have, 17% in that, the one that has 70, so the higher score, and 18.8% in the one with the lowest score. There doesn't seem to be a huge difference in income values. So how do you deal with that information?
So there is a methodology that's been used to calculate the neighborhood well-being score. And I'll ask Kevin to provide you with greater detail on that because he is from Peel Data Center and has supported this.
Okay, thank you.
So the way the weighting works is a statistical method called principal components analysis was used. And what it does is looks at major differences between those 245 census tracts. And if there's major disparities between a lot of those census tracts, the weight becomes higher. So it becomes a more important component. One interesting finding, for example, was that libraries, the servicing across Peel was almost, it was pretty uniform. So the weighting on that is pretty low just because it's almost a constant across the region. One thing we noticed is that the mobility, the low income, and there's a couple other ones that weight heavily towards and influence the score the most. So there might be census tracts with low income measures in the 20 to 30% range, and those ones would be affecting the score a lot more. So the one you were looking at, I think you said it was a 4% difference.
Well, one was 17 and one was 18.
Right. Chances are there's another indicator within that ward that's causing the big disparity in the index score. So, for example, the mobility is a big one. So a lot of the neighborhoods where a lot of newcomers come into, you'll notice have a lower score, and that's a combination of different things. But a lot of those also have high mobility. So it's hard to have a stable neighborhood when you're having people move in and out within a span of a couple of years or within a year, and that's likely what's a big influence in that example.
So we shouldn't be picking one or two items on this list as true indicators.
Correct.
It's kind of a cohesive review.
Yes, it's a combination of all those scores. So one thing we can do, we haven't released it yet, but we can release the methodology, which again is based off of the City of Toronto's methodology, as well as the weighting for each of those indicators that were used. So you can kind of see what makes the biggest difference in those scores and maybe what's not as big of a factor in those scores.
Okay. Yeah, it was kind of interesting because when I was looking at one, well, the one that I just mentioned that is a 70, and post-secondary education is actually my highest at 84%, and the low income is one of the highest at 17%, which is kind of an interesting statistic. So my other question is with regard to the data. Now, we're using mainly census data. So I'm sorry, what year was this from?
So the data is from the 2016 census.
2016,
Yeah.
okay. So do you feel, because we're using census data, and I'm not sure what else we can use, but by the time we get the new data, I mean, it's already so outdated. Have you noticed over the years, as we've been using census data for other social service reviews that we've done, that each time we get the new data, is there really a big difference that we're seeing, or is it fairly stable?
It's been generally fairly stable. I mean, the biggest changes you're going to see are in areas of high growth or high turnover in terms of population. So, for example, downtown Brampton, Mississauga City Center are areas of high turnover or Bramalea City Center, where you see people coming in when they first immigrate here or move to Peel, and then they move outwards towards maybe new housing that's being built.
Right.
So those areas we see a lot of turnover. It's been fairly consistent in terms of things like income within those 5 years. We don't have any major change.
No huge
generally.
disparities there from one census to
usually
another?
it's related to the age. So for example, certain areas in Mississauga, people are aging in place, and the population wasn't growing as fast as we expected it to, just because people are aging in place and not moving out. Their kids have now moved on somewhere else. So it's mainly around population. It's maybe a bit more surprising, but not in terms of things like income or immigration. Those are, I guess, there's certain known hotspots.
So when it comes to crime rate, the safety, under the safety, are we using current, well, I guess it would be 2019 statistics from the police on those numbers?
From police, I believe it's 2017.
2017, so we're still a few years.
So it's sort of like consider this a snapshot in time.
Yeah.
We were looking at possibly doing an update in between the two censuses. We would have to purchase the data for that, and it gets a lot more expensive once we have to do that, which would be projected data to the current year that we'd be using, and that's something we decided not to do for now. For the next iteration, it might be something we could look at. The next iteration will be 2022, 2023 by the time all the data's out and we're able to put it all together.
Yeah, I would hope that we could do more current updates, because we're using this data to, I was speaking with our community services staff yesterday, and we're using this data to plan our services. So for example, we were talking about the youth hubs and things like that, and we need the most up-to-date data, because we talk about crime rates and low income and all of these other issues as we're looking at where we're going to put our funding into various parts of the region.
Right.
So I would hope that any of the data that is being used to make those decisions, because they're major financial decisions, that before we make those decisions, that some of the data would at least be updated in its relevancy for that. So thank you. It's an absolutely amazing tool, and I can see a lot of use for it, a lot of information. I think we have to be careful with it, because if someone goes in and uses it without really understanding and hearing what you have just said, I'm not sure they're going to get a really accurate, an accurate picture of each of the communities. But used in the right hands, I think it's very valuable. I think it could also be less valuable if used for different reasons. So thank you.
Thank you, Councillor Santos.
Thank you. Through you, Chair, as a data nerd that loves data, jazz hands on this tool. How often are we going to be refreshing the data and updating it? And I see that there are health centers in there. Does health centers include doctors, like just doctors' offices? The next question I also have is about transit and key transit hubs, because transit is also an important indicator for quality of life and well-being for residents. And finally, see, this is all the data nerd coming out, sorry. And then also we have an issue, as you know, with basement apartments in some pockets, especially in Brampton. And when you look at Ward 1, based on the well-being scores here, there is a correlation that I see based on the basement apartment data that we got from the city as to the concentration of basement apartments. But I would guess that basement apartment populations that are in basement apartments aren't captured in census data. But if you look at the well-being scores and overlay the map of where basement apartments are concentrated, you will see that there is a correlation. So just if you could comment on that as well. And then, 1 second. The other question I have is just about building on Councillor Sato's point about public consumption and how we message to the public, because when people see low well-being scores in a particular area, they will have their own misperceptions of what that community is. So if those are my questions for now, thank you.
Sure. So as I said earlier, our update we're looking at right now is next census period. So 2021, May 2021 is the next census. By the time all of the data is released, it'll be end of 2022. So 2023, we can get the data all put up and everything within 6 months or less. It's pretty standardized because it's their second time doing it. And then we can look at maybe doing a mid-census update. You know, if it's being used that much, it's worth it to spend that money to get that projected data for the tool. On the map, the medical centers are hospitals. The medical centers that are, like the big clinics that have their own buildings, and walk-in clinics. So not individual family physicians unless they're within sort of a walk-in clinic or medical clinic setting. So we don't have, individual doctors there. When it comes to transit hubs, we didn't include that in this. This tool is more focused at the social side of well-being. Transit obviously does play a part in that. And I think before the summer, you should be having a presentation from Public Health. There's a walkability score, and part of that is the transit component. So it looks at how close people are to public transit, frequent public transit on both their work side and on their home side. So we don't have that in here. This was more looking at the social side of things. That tool that will be presented in the coming months is looking at the physical built form of the region, and that's one of the 6 indicators they're looking at.
We may want to integrate it, though, because
Okay.
traffic congestion and car usage is an indicator of well-being and quality of life on the social side of things. And also on the social side of things, you usually see folks at this point in time in lower income brackets using transit. So because they have, if for example, in Ward 1 where there is a lower well-being score, investments in transit would potentially help the well-being of that community. So if there's a way to integrate that, that would be fantastic.
Yeah, like we do through the census receive transit use, the main way people get to work. And there's also a separate survey called the Transportation Tomorrow Survey that looks at how people get to work, school, appointments, anything they do in their daily life in that 1 week in May that they do the survey. So that's something we could look at too. When it comes to basement apartments, the way the census works is if StatsCan knows it exists, then they either send a survey there or the enumerator visits the location. So if they know the address or a unit exists there, they'll automatically send one. When their enumerator is going around through the neighborhoods, they'll look for separate side doors or mailboxes. And if that's the case, they'll go knock on the door, leave a census for them to fill out. So if they don't know about it, then they can't find it. I'm not sure if they're going to be using the Brampton secondary unit permits that are now posted online to help them with that or not. If it's sort of a multi-generational family within the same unit, that's captured by whoever answered the survey for the census for that household as the head of the household. With regards to the public consumption, so the messaging, that's why we have that box pop up right at the start, is to try and force people to read something when they first get there. We try to message it as this isn't a tool to put down a neighborhood, stigmatize anyone, to boost or lower real estate values. That's not the point of this. We make sure that people know that it's there for improving the neighborhood. So we try and make sure we message it as well-being rather than some sort of goodness score. So we've tried to be very careful with our messaging to make sure that people don't get the impression that we're stigmatizing certain areas or neighborhoods.
Thank you. Commissioner Sheehy, one final point.
Thank you. Through the chair, I did just want to emphasize for Councillor Santos' benefit that we are actually currently looking at a number of mapping tools that exist here in the region that have been created for specific purposes with an aim to try and simplify and integrate so that you would have a one-stop view of the community. So we are actively working on that. That's part of our next steps.
Very good. Excellent presentation. Here for information, if that could be moved by Councillors Sato and Santos. Show of hands. All those in favor? That is carried. Again, thank you very much. Okay, that brings us down to items related to human services. Councillor Maderos. I thought, so we dealt with the community, it was 11.1 and we noted, you're absolutely right. So on items related to planning and growth, Councillor Paleshi.
Thank you, Mr. Chair. We have before us item 13.2. 13.1 was put into consent. Mayfield West Phase 2, Stage 2 settlement boundary expansion was held. Councillor Sinclair, you held that. I turn the floor to you, sir.
Thank you. I'm trying to understand the process of decision-making here in the report. And it mentions that a land budget was endorsed by Regional Council for capital planning purposes in February 2019. And then it seems to be saying that the lands will be calculated for in 2041 review through the next municipal comprehensive review. So this expansion is outside of a municipal comprehensive review. And it seems that the decision-making here today is contingent on a future municipal comprehensive review, and that we may be a little bit ahead of the game. And then it says here that on 13.2.2, the recent direction for the province has provided clarification that upper-tier municipalities can undertake their municipal comprehensive review through phased amendments. So it looks to me as if this could be viewed as a spot development outside of any overall planning strategy, and that's what concerns me about Caledon, because of the vast areas of white belt floating around and no overall theme of planning for it. So how am I supposed to deal with my sense that this is premature? That's my question.
Okay, question, Adrian. Councillor Sinclair has a question on the region being proactive.
Through you, Mr. Chair. Certainly this issue and this project has been around for a long time and has been part of an extensive planning process. And it is a complex world that we're required to work in through the provincial policy framework around the growth plan, the growth allocations, the settlement boundary requirements, and the municipal comprehensive review. And we've actually been challenged. Not only is it complex, it's been changing frequently. We've had some frequent changes over the last few years to the growth plan and to the provincial policy statement that have affected things. So just to give you a little bit of the history of this. Yes, this settlement boundary expansion would be a part of a first phase, or one of the initial phases of our overall municipal comprehensive review. And it's and that ability to implement our municipal comprehensive review through phases is something that the region had lobbied the province to give us the authority to be able to do that. And something that that the minister did provide a letter to heads of councils across the GTA last fall, indicating that we did have the ability to implement our municipal comprehensive review through phases. And our municipal comprehensive review has already had amendments come through around healthy development, age-friendly planning. And so we've brought this forward, and it really implements a long-term planning process that has been underway for many years by both the town of Caledon and the region of Peel for Mayfield West. And it goes back to the original Mayfield West Phase 2, Stage 1 lands, which were brought in through ROPA 29. And at that time, leading up to that, starting back in 2008, we'd looked at planning for a larger community, logical boundaries, and the technical work was done. That work resulted in a change to the boundary, a reduction in the boundary, just to meet the growth plan math. And so in 2017, when the region brought forward our original growth allocation work around 2041, original planning for 2041, we had included at that time a proposed amendment that updated the studies, that looked at the broad needs for growth allocation out to 2041, and really acknowledged that in order to accommodate that growth, there is going to be a need for settlement expansion. Quite a number of hectares of settlement expansion, and of course that lands in Caledon, given that both Mississauga and Brampton are built out. And we also said we needed to embark on a process, which we're now fully engaged in, to look more broadly at what the proper boundaries would be for that 2041 work. However, we indicated that as an initial phase, the work that had been done, the need for complete communities, the recognition that really the planning that was underway had originally contemplated this phase, the Stage 2 additional lands for Mayfield West. We recommended that be brought forward as an initial phase, basically, of our municipal comprehensive review. And there's a number of reasons behind that. It does go back to the original planning. It does go back to sort of logical boundaries for complete communities. It also looks at the infrastructure that is in place already to accommodate that growth, and some of the shared infrastructure that'll be needed for the Phase 2 lands. And also the opportunity to capitalize on the infrastructure that's there. There isn't really anything major in terms of additional regional infrastructure that'll already be in place for the Phase 1 lands. And by bringing these lands forward now, we can I guess, acknowledge the work that's been done, and the decision-making that's been done, and implement that at the regional level, and allow for the local planning process to unfold, and ultimately that would result in the development charges revenues that would supplement the or I guess pay for the infrastructure that's been put in the ground. So that's where we are today. This will implement that initial phase of settlement expansion, recognizing that history and the work that's been done.
Thank you, Adrian. So Councillor Sinclair, you may rest assured we are not proactive. We are still reactive. But you still have the floor.
All right, thank you. And is it a clarification of what population allocation we're using for this? Is it, it looks to me as if we're using 2041 numbers now. And do we have authorization to do that?
Through you, Mr. Chairman. So the population allocation that the region's currently working with goes back to 2013, when the province amended the growth plan to include new allocations across the GTA, and they provided population allocations out to 2041. So those are the numbers we've been working with. They also introduced what's called 2031B. And what really that was an update to the 2031 numbers, and in Peel's case, it added about 130,000 people to Peel for 2031. So that's, referred to as the 2031B. these days, municipalities like Peel and all the others around the GTA, we're focused on planning out to 2041. So you'll see in the report and in the conversations now, people are talking about 2031, or 2041, sorry. The 2031B has become kind of a bit of a moot point. But in actual fact, when in 2017, when we brought forward our growth allocation work, we did look at that additional 130,000 for 2031. And where that would be allocated, and the lion's share of that will be seen in further growth and intensification in Mississauga and Brampton. But we did look at what would be required for additional for Caledon, and it was about 8,000 people in the 2031 timeframe. And this amendment is under that. It's about 7,000. So, rightly speaking, the timeline for this would fit within the 2031 timeframe, but it's really, part of the larger 2041 bucket at this stage.
All right, thank you.
Thank you, Councillor Sinclair. Councillor Downey.
Thank you. Through you, Chair. This is a long-standing matter that's been going hand in hand with the ninth line. It's unfortunate that Councillor McFadden isn't here today. I'm sure she would have liked to have spoken to the ninth line and the completion of her community. Beyond the approval and the support of Bill 108 and quicker housing to market, Mayfield West Phase 2 Stage 2 expands the Mayfield West Service Centre to include that remaining portion in my community and Councillor Early's community. So to us, it is the completion of our community. It's the completion of street networks, contributing infrastructure, efficient infrastructure, so we're not going back and rebuilding things later that we're already working on. And overall supports our entire Mayfield West community. The amendment is also proceeding as a one-phased amendment to the Region's MCR under Section 26 of the Planning Act. So I thank Adrian for that work, and Councillor McFadden and I had the ongoing joke that it's all good in completing the communities and more doors to knock on next cycle. So we thank you for that, and I would be happy to move staff's recommendation.
Thank you, Councillor Downey. Councillor Groves.
Thank you, Chair. Through you to Adrian. On 13.2-4, I'm just reading where through the EA process, you didn't include the Valleywood folks, and I'm just wondering, why would you not include them in that process? Because through the EA process is where I would say that a lot of things would be addressed and their concerns. And again, Valleywood has been a long-standing concern, and I've been on this file for years now, and these folks have been coming not only to Caledon, but to the region for years and years with their concerns regarding the 410 and the issue over safety. So I guess, so that's my question. Why would you not consult with them during that process?
Through you, Mr. Chairman. So the environmental assessment process that's spoken about there is really an environmental assessment undertaken by the town of Caledon to implement the Stage 1 lands. It's around implementing the Spine Road and McLaughlin Road widenings that are required for that process. And they undertook that in accordance with the requirements of the Environmental Assessment Act, widely consulted, and ultimately that was approved by the minister. And I understand the minister did receive input from the Valleywood Association. I think what is sort of noteworthy about that process is in the minister's approval and in the documents around the completion of the EA, they did indicate that that when they get into the detailed design to implement the EA, that further consideration of the Valleywood intersection, of the emergency access to the Valleywood community, that all of that should be further investigated, and that further discussion should happen through the detailed design, and that was embedded in the actual EA document. And in fact, in sort of recognizing that and hearing the concerns of the residents, what we've done is include a very specific and very strong proposed policy in the proposed amendment to require that implementation of the environmental assessment and the consideration of the intersection and the emergency access and those discussions with the community happen as part of the local process and as part of the secondary plan. So we've got that very specific and very strong policy in the actual proposed amendment that's before council today.
Yeah, and I see that in there, Adrian, and thank you for that. But the concern that I have, and I will go back to 410, Valleywood expressed the same concerns when they were looking at building the 410. And funny how things get changed from at the provincial level, because now you have a highway that they ran through the backyards of these Valleywood folks. And the concerns they've been there forever. And with this provincial government, I mean, I'm seeing things changing every day. Every week there's a change, and no consultation with the community, no thought or regard for people. So I'm sorry, but I agree with the Valleywood people. There's no trust here. There's no trust on the part of the province. There's no trust on the part of Caledon, because they've been duped before once. And you know what? And I'm not willing, and I'm going to put it on record, I am not willing to put people's lives at risk. I see what you have in here, but there is no good faith anywhere. And again, I've been working with these Valleywood folks for a long time. So we can write all the things we want, but at the end of the day, the province can come in and they can change whatever they want and they can do whatever they want, and we have no say, and those folks will have no say. Thank you.
Thank you, Councillor Rosen. I think that's a discussion that we've always had. The province can really do whatever they want in the end, right? Yeah. Thank you. Councillor Medeiros.
Thank you, through the chair. Thank you, Adrian. I guess just picking up on at the beginning of Councillor Sinclair. So my understanding then, we're attributing in 2040 numbers that will be in effect in 2031.
Through you, Mr. Chairman. So what we're proposing here is to have an initial allocation of the 2041 I guess targets that have been provided to us by the province, and that those would be implemented today and allow the process to unfold, right? So, but it's all within the overall growth between now and 2041. As I mentioned earlier, in fact, in addition to that, the overall 2041, the province did provide us an updated window, sort of between now and 2031, and that was an additional 130,000 people between now and 2031 when they provided those forecasts, and this would actually fit within that as well. So, you know, from a numbers point of view, practical point of view, it fits within the updated 2031. But in terms of the policy framework that we're going through now, the municipal comprehensive review, the overall municipal comprehensive view is a 2041 exercise.
Okay, and through the chair, thank you. And I've heard from my colleagues talk about completing communities. But I also, again, just from, you know, the probably limited understanding that I have. So if we're attributing 2040 numbers, and we haven't settled on the 2040 numbers, and certainly I would assume that there was some form of consultation with the lower tier municipalities to understand what those implications would be, because even, you know, at the City of Brampton, as the chair of planning, I haven't had staff come to me and talk to me about these implications, understanding, you know, little chats, but there hasn't been a real appreciation what possible impact that can be on the lower tiers. And then after, just from a communications perspective and understanding, I guess, the challenges and all the competing interests, what does that send to all other stakeholders involved in terms of, you know, this type of decision? Is it, you know, it's one thing to make I guess, a recommendation, understanding the full impact of all the numbers, and you go and you everyone has their allocation, so we get a complete picture of completing communities. But, you know, completing this part, does that leave other communities that won't be complete? And again, I don't know. And what stops then, again, other areas that from a planning justification could say we want to complete those communities,
So let's attribute some of those numbers based on good planning rationale. It almost undermines the whole 2041 exercise. So at the end of the day, why are we bothering with the 2041 exercise? Why don't we just go look at where we complete all the communities and start attributing numbers? And again, I don't understand this. Like I'm just looking from a limited perspective, but.
Through you, Mr. Chairman, as I was mentioning, though, this particular community and this particular sort of exercise around looking at the implications and considering complete communities has had a lot of work done and has been sort of on the books since 2008. So through those various exercises that we've undertaken at the region, through our growth management program, through the consultation that we undertook in 2017 around municipal allocation, through the initial land budget work, all of that, this has been carried forward and brought forward to the public as something that's being contemplated. And even with very conservative consideration around things like intensification targets, density targets, all of that, we know for sure that there will be significant additional settlement boundary expansion required in Caledon to accommodate growth. That number may change a little bit as we go through in terms of the exact targets and if the province updates the 2041 numbers and what have you. But ultimately, we know there will be that additional needed. So this would in no way take away from the very comprehensive intensification planning that is going underway, for example, in Brampton with the Vision 2040 and all of that work. All of that has been factored into our thinking and as those plans have evolved, is being factored in to the growth allocation work that we are doing and working very closely with, well, both the local municipalities and our colleagues here at the region that are undertaking things like the water wastewater master plan, the transportation plan. So all that is built into both the studies that have been done for this process and the broader growth management and growth allocation work that we're undertaking here at the region.
So, and just lastly, through the chair, and I appreciate your answer. My again, limited understanding is that there's already allocation there for residential that hasn't even been initiated. So us providing more allocation on top of already allocation that hasn't been even initiated, what is the hurry? What am I missing? Why isn't there a proper the allocation that already exists hasn't even been started. So you're telling me I'm going to give an allocation because someone just wants to ensure they have their allocation for us to hopefully in 20, 30 years, 40 years, because when we're talking about completing community, this allocation is not going to complete your community tomorrow. These are great to say you're going to complete my community, but maybe I won't be around when we complete the communities. So I don't know. I'd like to hear comments from my colleagues, but I think the coined phrase "completing communities" is a little bit of a facade right now. I think we're playing with jargon, but I look forward to see what my colleagues say.
Thank you, Councillor Medeiros. Councillor Crombie.
Thank you, Mr. Chair. So I'm listening to my friend, the councillor here, who's leaving the room as I speak. Thanks a lot. There you go. He's making a lot of sense. I mean, there are a lot of concerns about this. It just seems so rushed. I'm listening to Councillor Sinclair. It sounds like we got the cart before the horse here. I mean, are there any other development proposals using 2041 numbers?
Through you, Mr.
This
Chairman.
is using 2041, let's be clear.
This would be part of the overall 2041 bucket, yes. Through you, Mr. Chairman, in terms of using 2041 numbers, this would be the first amendment coming through in Peel using that 2041. And I guess to be clear, one of the criticisms of the overall planning process around the GTAs have been around things like the secondary planning process and bringing things forward to market. So ultimately, this would be implementing the next stage of that process for this community that's been underway since about 2008 to put in place that regional settlement boundary expansion, which should then let the local process proceed. And I guess the example here is the their stage one lands that are underway. One of the reasons that they haven't proceeded is because some of the complexity in dealing with issues around the province and the GTA West and the getting through that next stage of the local process that this would allow to unfold.
So Adrian, you just said stage one hasn't proceeded, and now we want to approve. And that, let's be clear, this is for approval today. And so stage one hasn't been even proceeded, and now we're looking at stage two. So is this good planning?
Yes, it is good planning.
It's good planning to,
I believe it's good planning because of the reasons I've talked about in terms of the work that's been done, the opportunity to see this community completed, and we have the technical basis in which we're confident in recommending it, and that's why we brought it forward today.
Adrian.
We're done our work and we're ready to bring it forward.
but completed, it hasn't even begun, and you use numbers that haven't even been allocated yet, and you've got other development proposals that haven't even been submitted yet. Wouldn't good planning being doing a complete MCR so we could look at things in totality?
Point of order, Chair. I
excuse
believe
me?
the mayor.
On a point of order?
The mayor is questioning our staff's professional integrity at
No,
this
I'm
point.
not. I'm asking questions about planning, Counselor. So I'm asking, why wouldn't a complete MCR be done instead? I mean, you're applying numbers that haven't been allocated yet.
Through you, Mr. Chairman, certainly, the comprehensive municipal review that we have underway to look at settlement expansion and the need for undertaking that is something that we are we're focused on, and we're in the process of doing diligently now. However, having looked at this over now a number of years, we have come to the conclusion that that this particular initial implementation of the 2041 numbers is something that we're satisfied and are confident on that's something that we can bring forward now on the basis of what's there on the ground, what's already been approved, what is being implemented at the local level in terms of phase one, and the technical work that's been done.
So Adrian, I got a few more questions, and then I see lots of people on the board, so I'll be briefer. So stage one hasn't been approved, hasn't proceeded, hasn't begun. You want to approve stage two on numbers that haven't been allocated. This is, in my opinion, I don't feel good planning. The residents, we heard from them this morning, they don't feel they've been heard. They want a further opportunity for consultation and for approval, and I don't think we do that after we pass for approval. We need to let them speak first. I don't like piecemeal planning. I think we need the full MCR here. And I'm very concerned that other applications could come forward. They'll compete for these 2041 numbers, and the 2031 numbers in many areas are still in dispute, and we're allocating 2041. It doesn't seem to make sense to me at all. And my final question to you would be, how are you going to guarantee that we'll maintain those 71 jobs and people per hectare? Now that the province has lowered their target to 50 in certain areas that has been applied in Caledon before.
So through you, Mr. Chairman, so the amendment itself does call for a specific population and employment to be planned for, and that includes a specific density on a specific number of hectares. So that is embedded in the regional official plan amendment, and then our staff would be carefully monitoring the local planning process to ensure that they comply with the regional official plan.
I'd like at this point, Mr. Chair, to move deferral of this. No,
Okay,
deferral
I have-
tops any other motion.
I have four
believe.
more speakers. Can
I
we let
understand.
them speak?
Of course.
You'll hold the
If they have
deferral?
to speak to the deferral at this point.
Just to
That's how
clarity
that
to the
works.
clerk. Okay.
So you can carry on to your list, but they have to speak to the deferral. That's how this works.
No, I know how it works. I'm asking you to step your deferral down. I'll recognize it after we give the opportunity for people to speak that haven't spoken.
I'll agree to
and
that, but the
also-
deferral motion goes before the other.
Yeah,
Thank you.
no, I know how to
Okay,
chair.
I'll allow
Thank
them
you.
to speak. Thank you.
Thank you, Councillor. Councillor Parrish.
Okay, I'm going to be really careful so Councillor Downey doesn't think I'm being critical. First of all, Adrian, you're doing a good job. You're a man of few words, and today you are talking your head off, which either tells me you're nervous, or you're under a lot of pressure, or you truly believe in this. Come life or death, you want this thing to go through today, which I don't think too many planners get that excited about subdivisions where there's a lot of heavy lobbying going on in this area. I've been lobbied. I'm sure everybody around this table's been lobbied by some pretty heavy hitters. So thank God that hasn't happened to you. I'm going to support the deferral because, as we all know, we've got a big, huge OMB hearing going on. And because of the OMB hearing, we have asked staff, and Adrian's doing his best, to speed up the comprehensive review, not in little pieces like this. You're making it clear that for completing the community and for all the other reasons you've stated, which I accept, that this will be in that comprehensive MCR as a priority. I would much rather wait to see the whole picture, which I'm told we should get before the summer. Is that correct?
Through you, Mr. Chairman, so before the end of the year.
Before the end of the year.
Yeah, we'll have
you know
some-
what? A couple more months. They've been waiting since 2008. I think they can wait a few more months. I'm going to support Mayor Crombie's deferral, and I'm going to support the gentleman that came in earlier today, and I'm going to support Annette, who says that this is all connected. And I'm always in favor of something that's going to help us with that OMB hearing. And I think the full comprehensive review will do that. This will just be part of that, and it will be looked at in perspective with the others. The other thing I worry about is if this is successful, the other developers out there are going to go, wow, let's start putting some pressure on. We can get ours before that review comes through. And there's a lot of guys out there with a lot of money who would just love to pressure us to death. We've already had one presentation a couple of weeks ago from somebody that wanted to push things ahead. So I thank you very much for your answers today. They've been excellent, even though a little long. And it's like when Jennifer puts in one of her amendments, I always pay attention to the motion. When staff answers questions in great long answers, I always start really paying attention to what they're saying. And both things make me uncomfortable, Jennifer and staff. But that's 35 years of experience. I have little hairs that go off. So I'm going to support the deferral.
Thank you, Councillor Parrish, as jaded as that sounds. Councillor Innes.
Thank you, and thank you, Councillor Parrish. I'm glad that you pay attention when I bring motions and amendments forward. That means a lot to me. I hope the rest of my colleagues do, and I hope that they pay attention when I speak and ask questions too. So I think that this file has a long history, and to Councillor St. Clair's point about asking question about the planning and the process, I want to remind my colleagues, especially those around the table from Brampton who desperately wanted to have GO Transit come to Mount Pleasant. Because part of the reason why Brampton was able to get the population allocation is because we did a planning for an entire complete community called Mayfield West. There wasn't phases. It was Mayfield West. That planning was done as a complete community. There was MCR, there were community consultation and presentations, Valleywood Residents Association, everybody was consulted. We went through the Planning Act, we went through a planning process. And in the end, it turned out that Brampton needed 10,000 population so that they could get Mount Pleasant completed and they could get, more importantly, public transportation and GO Transit. So Caledon gave them the 10,000. We decided to phase Mayfield West to help not only the city of Brampton, but the region of Peel. And here we are today, 10, 12, almost 15 years later, and we still don't have a complete community. The population allocation, as it turns out, and I think some of my colleagues will remember me asking this question of staff when we were even talking about the 2031B, when that came forward to us, I asked the question, have we even fulfilled our allocations for 2031A? And the answer was no, we hadn't. And the reason why the 9th line got their population under the 2031 is the same reason that Mayfield West Phase 2 should get their population under the 2031B numbers, is because we didn't fulfill that requirement. And you clearly stated that these numbers are there within the 2031. Is that correct, Adrian?
Within the 2031B, yeah.
That's correct. So while we are doing a 2041, everything that we're working on from here forward is going to be rolled out into 2041. That's how it works. That's not to say that that population allocation isn't already there. And I can tell you, as somebody who represents the east side of Caledon, I don't want to give up any more population allocation to my side to any other side. And here I am advocating for Mayfield West to be completed because those are 2031B numbers. They're not 2041 numbers. They will be rolled into 2041, which goes to my further question, because I know a big concern around this table is the infrastructure cost and the cost for development. And so maybe my question might be better answered by Mr. Van Offwegen, but my understanding is that by permitting this to start moving forward, it allows us to sooner collect our development charges to help pay for the infrastructure, which is already there for phase one. Phase one infrastructure is supporting phase two. This is money that the region of Peel needs. This is not just about Caledon needing this development charge growth. This is about the region of Peel needing this development charge growth for growth that we've already paid for. So I think I'm going to ask Mr. Van Offwegen how deferring this or delaying this would actually would burden the region in our financial planning to deal with the development charges and the offsetting of the infrastructure we've already supported for phase one.
Through the chair, thank you for the question. Certainly, and I scan at page 13.2-25, which sort of helps me in my thinking walk this through. Certainly, the phase two, stage two would take advantage of existing infrastructure that's already been put in place by the region. It also, on a secondary level, allows the stage one infrastructure to be put in place to its optimal level at the same time for that infrastructure to go in and not have stage two in the plan will require, I would imagine, I'll turn it over to the Public Works Commissioner, but certainly would be complex for the stage one to finish to its full completion because the natural extension of all of that servicing goes right into stage two as a rounding off area.
So the natural extension, and the reason it's natural extension is because we planned this community 15 years ago. We did this work that long ago. That's why phase one rolls so neatly and tightly into phase two, because originally there wasn't phases. So I don't want to support a deferral today. I don't want this to move forward. We already are paying for it. The infrastructure is in the ground. This is about completing a community. We've already dealt with the numbers. The numbers are there. They're in the 2031B. This isn't going to impact the population allocation up to 2041. As a resident who represent, or as a councillor who represents an area that's going to significantly be impacted by that growth, I want to make sure that we're planning to meet communities. And yes, some councillors have said that this is a guise, using the term complete communities. Not when we're talking about infrastructure costs. That's what you guys all keep telling me. When we're planning communities, it's about infrastructure cost. So here you are, the infrastructure cost is telling you that we should be moving forward on this initiative. The province has given us the abilities to move on it under 108, and I think that we should be taking advantage of that so that we can move this forward. This community has been long waiting. And not only that, they sufficed to help the city of Brampton and the region of Peel. And now they're asking to move forward. And I think that it would be disingenuous for us to now turn around 12 years later and say, nope, we're going to ask you to wait a little bit longer. Thank you.
Thank you, Councillor Innes, although I don't think you'll find too many Brampton councillors around here that remember that kind of handshake deal. I certainly recall some of it, but that's only because of my last name. Councillor Sato.
Thank you. Well, I'm also supporting a deferral on this until we have the information that Councillor Parrish referred to. And when I hear the reference to ninth line lands, I think it's a little obscure because the ninth line lands are in no way similar to what we're dealing with here. Absolutely none. There is an existing official plan on the ninth line lands that when it was part of my ward, I was part of with the region of Halton. And the region of Peel had to adopt those lands when we brought them into the city of Mississauga. I was the councillor that was involved in the purchase of those lands by the city of Mississauga, the lands that we own, and I worked very, very closely with my colleagues at the region of Halton and the residents of my ward in the Halton official plan. The region of Peel was required to adopt those numbers, as was the city of Mississauga, from the Halton official plan. So it wasn't that we turned around and said, you know, we now have this land within the region of Peel, within the city of Mississauga. Let's build it out to be complete the communities, one of which is mine, as I do still have part of the Ninth Line lands in my ward. And I have to say, I have been intimately involved in the entire process of the Ninth Line lands. And it has taken an extraordinarily long period of time. I cannot believe that this was not dealt with long before now, to bring what we passed today. It's about time. There are various reasons for that, but we have finally done it. But Mayfield West is not at all the same situation as the Ninth Line lands. Those numbers were given to us. The population numbers for Ninth Line were given to the region of Peel and the city of Mississauga by the province of Ontario when they granted us what we had been asking for 5 or 6 years to move those lands into the city of Mississauga and the region of Peel. And it took a long time for negotiating and with Halton and the town of Milton to get them to agree to it. We finally did, and we were given the numbers. So they have been there for a very, very long time under another official plan. We're just simply moving it over into the region of Peel. So please do not compare what we're dealing with in this report with anything to do with Ninth Line. Totally different situation. You know, Councillor Innes, you kind of confused me because I heard from staff that this was the first use of the 2041 numbers, and you claimed that they are not 2041 numbers, they are 2031 numbers. So I'd like staff to clarify that. Are we looking at 2031 numbers or 2041 numbers?
Adrian?
So through you, Mr. Chairman, so it's a little bit complicated because there's two 2031 numbers. There's the 2031 in our existing official plan.
Yes.
Which this would not fit in. The province did give us a new 2031 number, the 2031B, which had an additional population for Peel, which we're now planning for as part of our overall municipal comprehensive review. But this would fit within that new allocation that the province gave us, called the 2031B, but that 2031B is not yet in our official plan. This would be an initial allocation of that.
Okay, so you're basically, we're being asked to approve a plan with numbers that we have not yet approved in our own official plan, going beyond the official plan. So I think, you know, for that reason and the reason that we're waiting for decisions to come down this year, I can't support the recommendation that's before us. I think we need to defer it until we have all of the ducks in a row and decisions made by this council.
Thank you, Councillor Sato. Councillor Sinclair.
Yes, thank you. I guess I want to say a number of things. If the population that's needed to support this proposed official plan amendment here, the population came from 2031B numbers, I don't understand why the report is talking about 2041. And that needs clarification, and the reason for that is the context of this decision in this massive zombie hearing of Brez. So I just, and I'm finding a real frustration. There doesn't seem to be any overall view of how to handle planning in Caledon, and I'm now seeing developer proposals show up here at Regional Council bypassing Caledon. I think the actual design of the project is good planning, good design, and fills out part of a community that probably should have had an overall approval many years ago. in terms of the interchange design, if there's a conversation somewhere about how that came to be, then I should be involved in it because I can remember at least 20 years ago being involved in that and have some history on that and the approval of the route of 410 running up there. So I think the overall design is good. I just found the report and the notion that council would somehow endorse an investigation for planning purposes for capital improvements, then coming forward as a full official plan amendment. So I remain somewhat confused here. Thank you.
Thank you, Councillor Sinclair. Councillor Downing.
Thank you, through you, Chair. I see how it can be somewhat confusing. It's a complex issue, as is planning. And I know a lot of us around the table probably feel like we could have accepted an honorary degree in planning. I know, I feel that way. So, no professional offense, Adrian. So I don't support a deferral. Obviously, this is my community. Regarding the VRA and their issues, there's not much else I can say to that. Is one individual that champions that cause. And I think if I were to go further down that rabbit hole, if my colleagues would like, we would probably have to go into camera. Ultimately, I'm not sure what a deferral will accomplish that the report isn't already telling us. And Adrian, maybe you can speak to the mechanism that the ROPA provides. And I will actually also go back a step. If just to draw your attention to the 9th line recommendation and the Mayfield West recommendation, they are in fact identical with just some wording changes as in Caledon and Mississauga, but those two recommendations as per the ROPA are identical. Adrian, maybe you can speak to the fact that this mechanism, the ROPA, is actually what puts the population into our official plan.
Through you, Mr. Chairman, yes. So essentially what the mechanism is that this ROPA would allow for the settlement expansion as has been sort of studied and described, and it would include very specific policies that require that as the municipal comprehensive review unfolds and the further settlement expansion, that this land and this population would need to be incorporated and accounted for in that broader process. So that's very specifically outlined. So basically, as we go forward with that MCR, this would be embedded into that.
Thank you. I'd also like to point out, maybe to some of the colleagues that were not here last term, that the report that this council endorsed and sent to the province regarding our MCR process and a phased MCR process fully endorsed this process and the 9th line collectively as an exact product. I'd be happy to, I'm sure we could dig it up. I think it was about 2 years ago. I remember it distinctly because we were lobbying the province to look at our development so that we could complete our communities, such as the 9th line and Mayfield West, and do it in a staged approach that would help all of the internal infrastructure so that we could get things moving and carry on with all of our development that's, as we've noted, waylaid by other issues. Thank you.
Thank you, Councillor Downey. Mr. Chair, are you on the board?
Yes, just a point of clarification, just so I'm clear. A couple of things. Number one, in fairness, the application before you, the Mayfield West Phase 2, Stage 2, it goes back to 1997, just to be clear, the genesis of where it came forward.
Point of order.
Point of order?
Point of order. The
Councillor.
chair is not supposed to try to lead the discussion or influence the
I can
result.
address that. Can someone please move that the chair be heard?
So I'm the chair, and I'm okay with you going ahead with a little bit of the background, as we've heard background from other members of council.
Thank you. The second point that I want to make, to be very, very clear, because I asked the question before, in these instances, this is not Peter robbing Paul to get what they want. This is the 2031 allocation and the world unfolding the way we thought that it would. Number three, with respect to Councillor Sato and all, the similarities between Report 13.1, 9th line land settlement, and this one are overwhelming. There's no question about that. But number four, and this is really my main point, to the movers of the deferral, I think you might want to give some clarity as to this is the specific reason why it's being deferred, and this is the date until which it will be referred, because I'm sure this is going to have a lot of repercussions at the end of the day, and I want people to be sure of what's coming forward, because I think a lot will be involved when these come forward. So if we could just have, are you deferring it to what point in time for what action to be taken by whom? I think there should be clarity around the motion for deferral.
Thank you, Mr. Chair, and I'll seek clarity on the deferral once I recognize Councillor Crombie to bring back the deferral. Councillor Parrish.
Well, if anybody wants any input on this, and if you're looking for a time frame, it's when the comprehensive municipal review comes through that Adrian's working on for the whole region. And I would guess he suggested that would be by the end of the year. So I think that's where the deferral should go to.
Thank you, Councillor Parrish. Move the chair be heard. Thank you. So just as the councillor to the south of this area, I want to reiterate some of the comments that I've made before. And I attended the public planning meeting in Caledon, where I believe it was one resident showed up to voice some concerns, but concerns that might have been able to have been handled further down the planning process. For my residents in the north end of Brampton, this kind of section that's kind of cut out, it probably should have gone up to old school, but that's maybe a different topic at a future date. I have the Snellgrove community to the north west of Highway 10, and I have the Valley View community to the north east side of 10. In that Valley View community, I have the Snellgrove seniors residents. Snellgrove seniors residents actually have to walk from their seniors home down to Mayfield because we don't have transit that goes north of Mayfield. And we won't have transit going north of Mayfield until we have a complete community. Unfortunately, the communities that are there, which have been built and living in for the last, I think I'm going to say 20 years, are waiting for Mayfield West, Stage 2, Stage 1, Stage 2, Part 2. So I have incomplete communities in Brampton waiting on Caledon because of Mount Pleasant, which I don't fully believe, but I get your point that there was discussion a long time ago about Mount Pleasant. And so I guess what I'm trying to say from Brampton's point of view, I think that it is impossible for us to not support Mayfield West Stage 2 Part 2 because it completes Brampton. It gets our transit up north of Mayfield, which we need. It gets other forms of transportation up north of Mayfield, which we need. I have hammerheads in the Snellgrove site that are constantly having a bylaw go around and pick up waste because people are dumping at the end of these roads, which are a major concern for residents that have in the Snellgrove side of things. I have a new application that went to the LPAT that was just approved for 31 some odd stacked towns on an acre of property north of Mayfield, north of the residence site. And one of the main concerns of the 160 residents that came out in the planning meeting in Brampton was we do not have transit north of Mayfield. I need to enter into a partnership with Caledon so that we can push the transit north of Mayfield. Unfortunately, I can't turn a bus around on Highway 10. I just don't think it's safe. So from the area councillor that this greatly affects on the south side of Caledon, we talk about piecemealing and not building complete communities. This is a perfect opportunity to put this forward because we've been dealing with this at the region for so long. And I think what we're hearing is it should have been done a long time ago. But now we're saying because of other circumstances, we've moved population around. We need to continue to move population around to build a complete community. This is how it affects my residents in Ward 2. Councillor Downey, are you on the board? Councillor Downey.
Thank you. This is actually a question for clerks. Going back to my comment regarding the report requesting the staged MCR approach for 9th Line and Mayfield West, is it possible that this deferral is actually contrary to the request that we made? Like we've petitioned the province to be able to complete this work in this manner, and now we're saying, hold on, we actually don't want to do it that way. We're going to wait till the way that you asked us to do it originally. We specifically asked to be able to complete this work identical to 9th Line in this manner through that report to the province. That was our official position. And now we are saying, no, we don't want to do it that way.
Councillor Downey, I'll move your question over to the clerks to advise on.
I'm going to have to ask, Patrick or Catherine to respond.
Patrick?
I would say that there's a logical inconsistency that you're pointing to. It's not such as to stop us from proceeding in the way that's being proposed, but it's logically inconsistent with previous council policy, at least council stated request.
So in essence, we are frustrating ourselves.
In essence, we asked for the ability to phase the comprehensive MCR in part on the basis that Mayfield West Phase 2, Stage 2 is warrants that kind of treatment, and not to proceed now that we have the ability to phase is, I would suggest, logically inconsistent.
Thank you.
Patrick, you're suggesting layman's term, it is inconsistent?
It is inconsistent, not legally prohibited, but inconsistent.
So are we suggesting that it needs a reconsideration? I won't recognize your point of order. I'll ask my question and allow legal to respond. It's a question.
Could you repeat the question, please?
Does this need to have a reconsideration for a deferral?
No, I'm saying that the deferral motion is proper.
Okay.
Legally and inconsistent logically.
Excellent.
Thank you, Patrick.
Thank you.
I appreciate that. So for
Thank
a
you.
council
Councillor Downey, you still have the floor.
that carries on and continues to grow as Peel will grow, knows that we need the growth, knows that we need to work together to complete our infrastructure, especially for Councillor Pelleshi and I, who border one another, to complete those transit loops, to complete our transit hubs. And Adrian, I would love it if you could put the map up on the board so I could show my colleagues the road that I'd like to complete that actually would let the residents leave the community, but can't without stage 2. It's on page 25. It makes very little sense to me that we specifically requested to be able to do the work in this manner, but now we're turning around and saying, hold on, let's wait. We don't need to do it this way. The work is complete. So if you look at this, you can see stage 1 and the black portion at the top, the roads to leave that community go through that section. I need to complete those roads. We need that infrastructure. The community needs that infrastructure. It's very simple. And logical. It's very simple and logical.
Thank you, Councillor Downey from the area. Councillor, it does seem that. Councillor Dasko.
Thank you, through the chair. Can we call the vote, please?
Calling the question, I have Councillor Fortini, who is no longer on the board. I have nobody on the board. Can I not? And we just vote on the deferral? And can we just outline really quickly the deferral again, Councillor Crombie?
Well, my concern is incomplete communities exist because we are piecemeal planning, so we need a complete MCR.
The deferral is to?
Until MCR is complete.
Okay.
Thank you.
Do you need a seconder?
Oh, I got a seconder.
Seconded by Councillor Medeiros. Recorded vote?
Yeah, I'll take a recorded vote on this one.
All in favor of the deferral? the deferral carries and Ward 2 residents lose. Thank you, members of council. Councillor, Mr. Chair, I pass the chair back to you.
Thank you. I'm in the hands of council. We're at 12:45. Is it the wish to break for 15 minutes and grab lunch and come back in? Thank you. I take that as direction. I hope if I can get you back in 15 minutes for 1 o'clock, we stand taking a break while we have a bite and come right back in 15 minutes. Thank you all. Welcome back. I'm told I have the numbers. Thanks to those of you that were promptly back in place to deal with item 16, item related to enterprise programs and services. Chair Fonseca to deal with the communication items.
Thank you, Mr. Chair. So item 16.1, Robert Serp, Executive Director, Region Appeal Police Services Board, was held by Councillor Parrish.
Yes, I just want a clarification. It indicates that these are external funding things, not in our budget. But are they reliable sources of funding? Are they something that we get every year, or is it at the whim each year by year?
Who can? Stephen, give it a shot. Thank you.
I can certainly give it a shot. The funding is, most of it is reliable or has been reliable funding in the past. The police were recipients of some funding announcement earlier this year as well for 2020. And this is just a typical annual report that they provide. I think council had requested it a couple of terms ago just to get the information on the funding and to what extent it was reliable. The report isn't quite clear as to how reliable it is. But then again, this government has made many changes on funding levels.
Well, lots of the senior governments re-announce things 14 times, and it's not 14 times the amount of money. Thank you for that. I'll move receipt.
Okay, thank you very much. Just a show of hands, all in favor? Carried. Thank you. And item 16.2, I believe Councillor Parrish, you held this as well.
Yes, ma'am, I did. What's still not clear to me, it says on page 4, they ensure that on-duty personnel and police assets are utilized fully or partially for those events where it is deemed necessary after considering the need to ensure public safety and the need to provide core police responsibilities. For example, if you look at some of the funding, there's a Calsa parade that happens in Malton. They're currently now getting money as of that fund we had for the last 3 years. But they are really closing roads and ensuring the safety of people. So would that not be, as it is when they cross over into Etobicoke, and I don't know who can answer this, would that not be, I see the chair up in the stands, would that not be considered traffic control, safety, all those things, so you'd have regular on-duty officers doing it?
Okay. I'm not sure who can answer this.
Nando, you're
on the board.
And I also want to acknowledge that, and he stayed all morning long. Ron Chatha here, our Police Services Board Chair, who sat in just to listen to the conversation. And Ron, maybe you can help me out as the chair, but in the most recent discussion, when that came up, Councillor Parrish, and maybe Bonnie as well, and there was a big distinction that was being made through the chair of what we in the normal course would provide policing for and what would be above and beyond. Please don't quote me, but so there's Canada Day at Mississauga, and 100,000 people show up just for a good service. You would expect some officers there that the force would send out. If it's a one-off event, again, I'm making it up, like a Carasaga that might like some officers there, we would expect them to absorb that themselves. So the message being sent was that we want to manage it where appropriate, that the police should be there anyway. They're going to be there anyway. If it's a one-off, maybe it should fall to the group. Okay. Back over to you, Chair.
Thank you, Chair Unica. Mayor Crombie, did you want to
I had
add
asked the question to Rob Serpe yesterday, and he wrote a note that says, essentially, on-duty officers will only attend community events when assessment conducted by PRP determines that there is a need to preserve public safety and the need for core police responsibilities. For events that are deemed not to require on-duty officers as a result of the same assessment and qualify under the board policy, vehicle and administrative fees would be waived, but the cost of paid duty officers would be borne by the community event or through us. Note, these paid duty officers are only those that are not working a shift during the event. At no time are on-duty officers diverted to a community event as paid duty. Does that help?
As clear as mud.
There you go.
Perhaps Mr. Chair Chadha could take it back for a second round at this. Because one of the things we're doing right now as a region is we're subsidizing the ones that were cut off from the paid duty. Mississauga gets 266,000, Brampton gets another pile for events. The events are frozen in time. They are events that happened when the paid duty officers were discontinued. There's lots of new events that might need them more than the old events. Not that I'm trying to, take money away from Mississauga events, but right now it is frozen in time, and there was never a limit put on how long we were going to subsidize those for the transition. So part of it's our staff looking at that angle of it. Secondly, it's looking at a parade or paint the town red, any of those things where there's traffic involved in roads, I would suggest would fit in the category of requiring on-duty officers, and we shouldn't be paying for them. The third question I would have is if the police analyze an event and say it's the on-duty cops are not needed, can they still tell us we have to have X number of paid duty police officers? Or can we use private security, which is a lot less expensive? So if somebody could take those questions back, I'm happy to put them in writing. I'm trying to save the region money. I'm trying to make it more equitable for the events that are out there. And I'm also trying to get a final decision that a parade like Paint the Town Red or the Calsa Parade require police officers as a matter of course on-duty officers, and we shouldn't be paying huge amounts of money, $30,000, $40,000. Okay, that was all I wanted, and I'll move receipt.
Thank you. So then just from a procedural standpoint, Councillor Parrish has said she would put that in writing. Should that then be given to the chair to take to the Police Services Board?
And to all the members of the board, directly to the
Yes.
chair of the board that's here. Sure. Yeah.
Okay. All right, that's wonderful. Thank you. Councillor Carlson.
Well, thanks very much, Madam Chair. Karen, while you have your pen and paper in hand, perhaps you can make reference to the fact that we've been told at the Streetsville parades, both Bread and Honey and Santa Claus, that anything to do with traffic, you must have a field police officer to stop a traffic, to close an intersection. So every side street, it's got a little barrier that has to have a real on duty, like an officer who's been hired for on duty, and that's always been the rub, that with 14 side streets, there's 14 police officers times 100 and something an hour for a cruiser. So when you're talking about security guards, if there was any opportunity to loosen that up a bit, that would sure save the events a lot of money. But I understand that's something from a legislative point of view that you can't block a street without a police officer or something like that. So that's thing that could be cleaned up a little bit.
Okay.
If I might be allowed, Madam Chair, to speak, the new police chief is doing fabulous work. He's changing things rapidly, and I compliment the Police Services Board for choosing him. I think he's doing a first-class job. I'm speaking not as a criticism, but more as helpful hints so that we can change some of the things while he still seems to be in a change mode. He's fixing a lot of things, so I just want to make sure everybody understands that we're offering to work hand in hand with him. I think he's doing a great job.
Okay, great. And you will move receipt of the correspondence? Okay, all in favor? Carried. Thank you. Any opposed? Some people didn't raise their hands. Okay, carried. Thank you.
Thank you, and Ron, I'll thank you again. Chair Chatha spent most of the morning here just waiting to try and address whatever concerns we have. So Chair Chatha, thank you very much for devoting so much of your day to this and taking back some information. All right, that brings me to other business. And just for the record, I note that Councillor Parrish still had pending the question about the CAO and then the notice of motion, Councillor Sato, about electronic options. So I'm going to go under other business to Councillor Parrish first. Though Councillor Parrish, I'll remind you, staff reminded me that at the next PPC meeting, March 26, an update was coming on CAO. But with that, I turn it over to you.
Okay, I'm going to put on my diplomatic hat. I have realized, I was away on December 19th when this motion was passed. My husband was having a fake heart attack, but we thought it was real at the time. His sports channels got changed and he had anxiety. Anyway, he was in Trillium and got great care, and we found out he's got zero wrong with him, so the next time his channels don't work, we're all ignoring him. So I wasn't here when this motion was moved, but I started getting phone calls as chair of procedure and policies as to what's going on, when are we going to hear, when are we going to choose the company that's going to be doing the selection. So I asked Catherine, and she sent me the motion that shows that the motion was two parts. It was one to authorize the staff to do the search for the company that was going to do the hiring, and the other was to go to procedure and policy after that. So that was last Thursday. I got the answer Friday, good answer. So it sort of settled me down for a bit. And then we had a conversation yesterday with some of our staff at Mississauga, and we're reminded that the only hire we get to do as counselors is the CAO, nobody else. And the question was, why did you give that to HR to choose the company? Because the company sets the tone, they decide who they're looking for. And I guess my next question is, how far along is that process? And do we have a company chosen?
And Carolyn, your question is pending. Before I go any further, does anybody need or feel the urge to advise me we should be in camera to discuss this? Everybody says we're okay. Patrick, we're okay? Carry on. Question. Who can answer the question?
Through you, Chair. Yes, the firm has been hired.
And when were the firms, how many applied?
3.
And when were they informed that there was a choice made?
The purchase order for the selected firm was yesterday. It was yesterday.
Was it after 1 o'clock when I sent you a message saying I would like to discuss it today?
For the purchase order?
No, I'm not talking about the purchase order. I'm talking about notifying the company that was selected.
They have been notified before yesterday, yes.
They were?
Yes, correct.
And the companies that didn't get it were also informed before yesterday?
I'm not sure about that. I can double check.
There's a head shaking no up there.
No, they have not.
Can you tell us who it is?
Yes, I can tell you who it is. It is Feldman Daxon.
Is that not the company that just did the Brampton search?
It is.
Well, can I ask how we would get out of this if the purchase order hasn't been given?
The award has been made.
All right, answer my question, please. How do we get out of that particular choice?
I'd have to defer to Patrick. It's already been awarded. It went through the proper process based on the council resolution. We started a procurement process, RFP. There were 3 applicants. It was evaluated pursuant to the...
Were they the least expensive?
Only one made it to the cutoff to have their pricing envelope opened. They were the only ones that made it past the 70%.
I don't understand what that answer means.
It means you don't open the pricing until after they've already been qualified.
Okay, and what were they qualified on the basis of?
They were qualified on the basis of proven reputation and capacity in CAO executive municipal leadership recruitment, firm's experience, and recruitments of similar scope, size, and complexity that have been completed within the last 5 years, and references the recruitment strategy, their schedule, and experience of the team lead and the team members.
Okay, Patrick, could I ask you, how do we get out of this?
Through you, Mr. Chair, that will depend on the provisions of the RFP that was let. I'd have to have a look at the actual wording.
Okay. On the basis that this is the company that did some hiring for Brampton without telling them one of the people that was being hired was under an investigation, I would suggest we have absolutely good reason not to fulfill this contract. So walk me through how we do it. Just forget the details in the contract. Just tell me how we do this. Do we pay them $40,000 to go away?
Assuming that there is not a termination provision that could be triggered in the contract in those circumstances, it would be a question of what is the lost profit, essentially, of the consulting firm by reason of having been denied completion of the agreement.
So if the contract, let's say, is worth, I was told it's under $100,000, so let's say it's an $85,000 contract, you would just look at the profit from the $85,000, not paying all the people and doing all that? Okay, could you advise me what sort of motion I could put right now to terminate that contract?
I think it would be a straightforward motion to direct staff to terminate the agreement.
Okay. Then I would like to move the motion that we terminate that contract before it even starts. And if there is a clause that we have to pay the lost profit, we do that. I'd like the opinion of some of the Brampton councillors to see what they think about this, but that was not a good experience, I understand.
Commissioner Lockyer, go ahead.
Procedurally, I think before you even would start with that, you'd need a motion, a two-thirds motion to actually open this as a discussion because there was no notice given for any kind of motion today. Secondly, if the motion is how you want to actually proceed beyond what is already decided on December 19th, which was directing the Director of Human Resources to do exactly what she did.
Yes, no, I'm not questioning that. I agree that was the motion. I'm just saying I wasn't here.
Right.
And if I had been here, I would have talked us out of it because this is the one hire that this council as individuals get to do.
But the fact is that that is the motion that was passed, which would
Get
mean
that.
you'd need two-thirds again to reconsider
Well, you're
that.
going to Part
So-
B. I haven't quite gotten there yet. Part A is to terminate this contract. Then I will ask for two-thirds to reopen that motion and change it so that the policies and procedures.
Point of order,
committees-
Mr. Chairman?
Yes.
If we're going to get into any details about this, I think we need to discuss it in camera.
Yeah,
I didn't know where this was all going at the beginning.
Which I attempted, but was told we were
Well, I
okay.
didn't know,
but,
so.
Yes.
Through to our solicitor, do you feel more comfortable now, having heard this much of the conversation, that it should be dealt with in camera?
I think it would be prudent, given the turn that this has taken, to go in camera.
Very good. So why don't we, Councillor Parrish will be in camera shortly.
Great with that.
But even then, through to the clerk, do I need a formal motion to treat it as an in-camera item? It needs to be moved and seconded to go in
Yes,
camera
yeah.
to be dealt with.
Yes.
So Councillor Parrish, you're moving that it go in camera. I have a seconder. Councillor Sato, all those in favor of this being added to the in-camera items? That carries. Thank you. Councillor Sato, I come to you. Next item I had notice of motion, the electric options as you discussed earlier. I understand something may be coming before us. Councillor Sato.
Yes, staff have prepared a motion, and I think they're going to put it up on the screen. There was one addition, which I'm hoping is in here because I have the original one, that it was pointed out that the Municipal Act currently states that electronic or distance participation cannot be counted for quorum. And the reason that we are doing this is because we would fail for quorum. So I have suggested that we have the chair immediately contact the province of Ontario, and this is going to affect other municipalities, because, I mean, we're looking at it in Mississauga, and so is Brampton, to immediately contact the province of Ontario and ask them to pass an emergency amendment to that portion of the Municipal Act that would enable members of council that have to be put in that position to count for quorum. So whatever wording, it's flipping here, sorry. Yeah, I don't want to say the possible advocacy. I think we need to be very firm in this and just say that the chair immediately contact the province and request that they make an immediate legislative amendment to remove the proviso that members participating, and I would be very clear on this, that it would be members of council participating, because the Municipal Act wording also refers to citizen committees. So we need to be extremely clear. We're going to be doing the same thing in Mississauga, and we can't deal with it until March 25th, which is our next council meeting. And our clerk was going to be in touch with Catherine, I would assume, or Ava, to discuss so that we get the same wording in the city as well. Legislative.
Through to the Commissioner.
I
Commissioner
would
Loughlin.
say an immediate legislative amendment to move through the accounting when a member is present. You might want to add in for this, in this situation. So, because we're not asking for it forever, we're being very specific for this situation, should it occur.
Commissioner, some guidance.
Through you, Mr. Chair. That was what I was going to clarify, Councillor Sato. The reason that the Municipal Act was written the way that it is includes the restriction on quorum, it talks about participation. That was one of the reasons why generally the legislation has not been taken up by many, if any, municipalities, because it's written in a way that's very unclear. They talk about a member may participate, but then they're not counted for quorum. It doesn't mention about voting. It doesn't talk about voting. So to request to the minister for a legislative change of a provision that's not meant for just emergencies, but rather is meant for general conduction of business, where this motion is very particular to these particular circumstances today, right now, that's why we were referring the matter for advocacy to the Government Relations Committee so that we could actually clear up the whole thing.
We can't wait. I mean, this is a situation that we need to deal with today. Our next meeting is not until April. We are dealing with it in Mississauga. We are passing the motion on March 25th. We're passing the bylaw that would enable our council at General Committee or council, if there was a need to invoke this, that we would be able to meet and continue with government business. We don't want to be caught in a situation where all of a sudden something happens, the majority of council are in isolation or whatever, and we cannot carry on business, which means no decisions would be made here at the region, staff couldn't do their jobs. I mean, if it's an emergency situation, you said that you have, you've invoked the emergency. This is part of that. And, I'm not prepared to refer this to the Government Relations Committee. This has nothing to do with government relations. This is doing the business of the region and ensuring that we have the ability to do it. I'm hoping we will never, ever need to use this. But if we do, then we need to have it in place. We need to have the bylaw passed today so that if something happens before April 6th or whatever the date is, April 6th, which is our next meeting, that we will still be able to participate and do the business of the region of Peel, because otherwise it's not getting done because it has to be done by council.
Through you, Mr. Chair. Yes, that's where I was going, was that if this request to the minister is related to this particular situation, immediately is the answer.
Yes.
Yes, yeah, I don't have any qualms
Yeah,
with that.
I'm not talking about any other situation down the road. I mean, there may come a time when, excuse me, when we want the province to have something in there that refers to emergency situations.
Right.
But today, it's dealing with the virus and the potential for us not being able to meet as a council.
And the other issues that you raised were addressed in the wording of the motion as far as the voting and the attendance.
Yeah.
Okay, thank you.
Okay, so I think that's got it. I've got the motion before me. You've added the word immediate, as you see on the screen.
In this
Given it's on the
situation.
screen and duly moved by Councillor Sato and seconded by Councillor Parrish, I will take it as read. Madam Clerk, a show of hands is good enough. You want a recorded vote? Go ahead, keep voting. All those in favor? And that carries. Thank you. One last kick at either other business, councillor inquiries. Seeing none, no notices of motion. Madam Clerk, am I on to the bylaws?
Yes.
I probably have a motion on that. Take a moment. Here we are. I have a motion moved by Councillors Vincente and Innes that the bylaws listed on March 12, 2020, Regional Council agenda being bylaws 18-2020 and 21-2020 inclusive, be given the required number of readings, taken as read, signed by the regional chair and the deputy regional clerk, and the corporate seal be affixed thereto. All those in favor? Oh, Councillor Parrish, sorry.
Bylaw 21-2020 should be removed.
Yeah, I thought that. And the mover and the seconder are happy to do that, of course, following what happened earlier. So with that amendment, that it be 18-2020 alone. You've heard the motion. All those in favor? That is carried. In camera, I need a motion to move in camera. Madam Clerk? If someone could move that, if Councillor Downey and Councillor Fonseca move the resolution that we go into camera to consider the reports related to the following, and you see them listed as 21, the February Regional Council closed session, early years is 22.2, the Heritage Feeder Main is 22.3, and the matter that Councillor Parrish raised as well. All those in favor of going in camera? That carries. Thank you. If I could ask those that need not be in the room to quickly make your way for a moment. Okay, the doors are open. We are back properly in open session. There was something that arose that Councillor Parrish raised about adding a new issue to our agenda that was not given proper notice. Councillor Parrish, what was the matter you wanted to bring up?
I would move, please, that we have a discussion on the contract for the search for the new CAO.
Thank you, Madam Clerk. That amounts to an item that was not on our agenda, so I believe we need 2/3 to even deal with the matter. Is that correct? Yes. I'll ask you to call the vote at this time. That's a formal motion, though, from Councillor Parrish and Councillor Sato. Very good, that we reopen, we deal with the matter, open it so that we can deal with it today, not having been given notice. I need 2/3. Madam Clerk, recorded vote or show of hands? I'll do a recorded vote. We need 2/3 to deal with the matter today. And that is carried. We have leave to deal with the matter today. Councillor Parrish, having opened the matter successfully, what is your motion before the chair?
My motion to the chair is to terminate the contract for the search for the CAO.
Very good. Do I have a seconder for the motion? Councillor Medeiros. Does anybody wish to speak to the motion? Seeing no one, Madam Clerk, a recorded vote again? Yes. Recorded vote on the motion before you. That carries. Finally, Madam Clerk, I think Councillor Parrish might have had one more motion procedurally, how we go forward from here. Councillor Parrish.
Procedurally, we would like to move the matter of the hiring of the CAO or the search to the Procedures and Policies Committee.
Very good. Do we have a seconder for that motion? Councillor Groves, I think I heard first. Okay. Duly seconded. You've heard the motion. Do I have any speakers to that motion? Seeing none, I need a recorded vote again. And that carries. Okay, with that, that brings me down, Madam Clerk, am I correct, to the confirming bylaw? Do I have anything else before the chair? We properly moved out of in camera. That was done. So I believe I need a bylaw to confirm the proceedings. Take a moment. Sorry? Oh, okay. So why don't you pluck that for me first? That was dealt with. Let's formally deal with what came out of in camera, as moved by Councillor Kovac and seconded by Councillor Santos, that the February 24, 2020 Regional Council meeting session report be received, and further that the in-camera directions related to items 22, 23, 22.2, 22.3, listed on the March 12, 2020 Regional Council agenda be approved. You've heard the motion. All those in favor, show of hands. That carries. Thank you. The next motion moved by Councillor Sato, seconded by Councillor Early, that the bylaw 22-2020 to confirm the proceedings of the Regional Council at its meeting of March 12, 2020, and to authorize the execution of documents in accordance with the Region Appeal bylaws related thereto be given the required number of readings, taken as read, signed by the Regional Chair and the Deputy Regional Clerk, and the corporate seal be affixed thereto. Show of hands, all those in favor. That is carried. And I have a motion to adjourn from Councillors Downey and Mahoney. All those in favor. Oh, sorry, Councillor Downey was not in her chair, so it's been moved by Councillor Fortino, seconded by Councillor Fortino. Same motion, all those in favor? That is carried. Thank you all.